Yes, sir.
All right, I'm going to go ahead and start. Good evening. I'm John Higdon, Mayor of Matthews. Welcome to our April 27th, 2020 Town Board meeting. Tonight we're going to be using the Zoom platform. This is being live streamed over YouTube. I'm going to forego introductions. Everybody's name should be visible under their image.
Yeah.
I'd like to read this. Due to Mecklenburg County's COVID-19 stay-at-home order, this meeting of the Matthews Board of Commissioners will be conducted remotely using the Zoom virtual meeting platform. Town of Matthews is committed to transparency and robust public participation during these challenging times. I do want you to know that tonight when I call for votes, I'm going to ask the commissioners to vote all at once by indicating their vote by raising their hand and saying yay. If there are any dissenters, then we will do a roll call and call each person individually tonight. Before we get started, these are very stressful times, and I thought I might like to share something, bring a little levity to the meeting. You may have noticed that I got a haircut. God bless my wife, Penny. She attempted to cut my hair, didn't do too bad of a job. And she told my children this weekend on the phone that she had cut their father's hair, and my son said, "Where did you ever find a bowl big enough for Daddy's head?" So, he thought his last semester of college was going to be paid for, but that's not going to happen now. So have to get a job somewhere. Okay, so we've gone over the rules for voting. We'd like to go to agenda item number 2, which is invocation, and I'd like to ask Commissioner Urban to lead us tonight in that.
Thank you, Mr. Mayor. Heavenly Father, in these trying times, help us move beyond our anxiety and fears. You called upon your followers to not be anxious and cast all of our anxieties on him, for he cares for us. Blessed are those on the front lines of the pandemic, the nurses, the doctors, EMS. Blessed are those who go to work every day to protect and serve our citizens, like fire, police, and public works. Bless those who, through no fault of their own, have lost their jobs and their loved ones, who wait to return to some sense of normalcy. We will conquer the fear and anxiety, knowing these simple truths about your presence. Jesus is with you. He is in you. He goes before you. He is behind you. He is for you. He is over you. He works through you. His witnesses surround and protect you. Help us overcome life's fears and anxieties. In his name, amen.
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 Amen. Thank you, Commissioner Urban. I'm now going to lead us in the Pledge of Allegiance. And I have my trusty flag here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Manager, do we have any items to be added to the agenda?
No, sir, Mr. Mayor.
Okay, we're going to go on to agenda item number 5. Going to introduce some of our guests and lay down some ground rules for our discussion. We're going to have a discussion on COVID-19. Who we have with us tonight is our Emergency Operations Center Commander and Fire Chief, Bob Kinnenberg. We're going to allow him to give us a update on the situation in Matthews. We also have Novant Health Matthews Medical Center President Roland Debu and Director of Infection Prevention for Charlotte and Virginia Markets, Rhonda Mull, and Mecklenburg County Commissioner Susan Rodriguez McDowell, and also Matthews Chamber of Commerce President Kim Gossage. And so we're going to kind of have a panel discussion with those folks to discuss some of the issues, some issues that maybe our businesses are seeing, just any concerns at all, and there'll be an opportunity for any of the elected officials to ask questions of any of our esteemed guests. So I'd like to start with Rob Kinnenberg to give us an update. Mr. Kinnenberg, sir.
Good evening, Mayor, council members. As of 5 o'clock today, Mecklenburg County reported 1,491 cases of COVID, and we've experienced 43 deaths. Here in Matthews, we understand that we have 35 residences who are in isolation due to COVID in 19 areas across the town. I've kind of, since we last met on April 13th, The town of Matthews continues to take an active role in the policy group teleconference and ad hoc discussions on a daily basis. We track the use and inventory of PPE and report that for a countywide tally. We executed a countywide resolution aligning the expiration dates of the county stay-at-home order with the state stay-at-home order. In the last several weeks, we have had regular communication with our town's skilled nursing facilities so we can better understand their needs. And last week, we drafted a new town ordinance that you will act on this evening, which aligns the provisions in the North Carolina Emergency Management Act with general statutes and our de facto policies over the last several years. In Mecklenburg County, on April 21st, the Public Health Director presented data on the cumulative reported case for the county. Data suggests that our efforts to slow the spread have been successful as compared to forecasts with no intervention. Public Health's forecasting on the 21st indicated that the peak for COVID-19 infection hospitalization would occur sometime between mid-June and mid-July, depending on the degree of compliance with the physical distancing or social distancing scenarios. In each scenario, the number of cases at peak was projected to stress hospital, ICU, and ventilator capacity. On the 23rd of April, the governor extended the stay-at-home order through May 8th and proposed a three-phase easing of restrictions. The easing of restrictions is tied to the achievement of several COVID-19 containment statistical milestones. And on the 24th, the governor announced that schools would not reopen before the end of the current school year. Again, we're tracking 34 residences in 19 different locations across the town. Those are reported to us by the health department for information to aid our responses by police and fire. That's the end of my report, Mayor.
Thank you, Chief Kinnenberg. Do any of the elected officials have any questions for Chief Kinnenberg?
Is it 34 or 35, Chief?
By last count, which was yesterday, I believe it's 35. We have had a few roll off the list because the end of their isolation period has come up.
Any other questions for Chief Kinnenberg?
No, sir.
Okay, so we're going to move along. I'm going to afford each of our guests the opportunity to make an opening statement if they wish, and we'll start with Roland.
Thank you, Mayor. Thank you, Council. Great citizens of Matthews. Appreciate the opportunity to be here tonight. I have with me our subject matter expert in infectious disease, Ms. Rhonda Mull. What I would like to open, when we began this journey I'm going to be specific to Matthews Medical Center a little over 6 weeks ago. The first 2 weeks, I'd say 2 to 2.5 weeks, the medical center received many COVID patients, and I'd say 15 to 20% tested positive. The remainders ultimately were not detected or negative. Subsequently, were either discharged out of the emergency room or admitted, and then during their course of stay for their related treatment were subsequently discharged without a problem. The individuals that were tested in the emergency room, when we subsequently received their results, either negative or positive, we would notify them, as well as the health department. If they were positive, we would ask them certainly to be on 14 days of quarantine, obviously with very little contact, even with family members. In the last, I'd say 10 days, we have seen, I believe, a very good decrease in the amount of investigation for patients with COVID, ultimately with positives. We've seen a pretty good decrease in the positives. We really do believe, and you hear this across the national airwaves, well as the state and local, that social distance and stay at home has made a dramatic decrease for us. The amount of positives that you are hearing nowadays with our long-term care facilities, also known as congregate communities, that have had our greatest challenge. That's why I am so happy for you to invite us tonight, because if we do not continue our social distance, and as relegated by the state as well as Mecklenburg and subsequently the towns, we could see an upscale tick up again. And the concern for me as a medical center leader is the amount of PPE supplies that we utilized in the first 3 weeks. We felt like if we stayed on that course, that our supplies would be exhausted within 2 months. Since that time, with the fairly good drop in these type of patients, we've been able to keep our PPEs in case that we do see a rebound like we did the last 5 weeks ago. So obviously, from my perspective, I'm really asking our citizens and certainly businesses that if we do loosen up business aspect, that we do maintain social distance. This is not a time for us to look back what I would suggest is the good old days of normalcy. There's no such thing as that at this point in time. So we really need our citizens to embrace. Trust me, we get the economic impact. Our medical center has felt it significantly, not just for our team members, but our company as a whole. So again, certainly I'd like to echo what the governor says, what the not just our federal, but our international audience has said. Social distancing does matter. Rhonda, would you like to add some of your thoughts, please?
Sure. Thank you for the opportunity to be here this evening. Echoing what Roland has shared, as well as Mr. Kinneber, the information with social distancing is absolutely paramount as we start to loosen up some of the restrictions on the travel and the mobility of our community members, making sure that the whole environmental cleaning, making sure that still stays on the forefront as well, the hand hygiene, making sure we're not touching our face. Navant is actually working with a Masking the Community campaign to help provide masks, to do some of the source capturing of those organisms as well, so that they're not spread into the environment. So kind of a twofold approach there to limit those organisms. So the social distancing is absolutely paramount. We have seen a great decrease in the projection for the number of patients and people that we will see in our facilities, which is absolutely necessary for us to maintain our resources and be able to provide the care we know that we can provide for them. So that's very important. Making sure that the testing, the health department has been working very closely with Novant Health about testing and making sure that the testing is carried out with the right people, that the right people in the community are being tested, that we're not missing people that should be tested. So all of those things, I think, pulled together will make a big difference. I think everybody here probably still has some concerns about relaxing that stay-at-home order as we look forward to moving forward, but making sure that we do it cautiously in those decisions that we're making. So thank you.
Thank you. Let's move on to Kim Gossage, President of the Chamber.
Mayor, could I ask Roland a question, please?
Sure. I was going to wait till everybody finished, but that's fine. Go ahead.
Hey, Roland, being that the reports are showing that the people of color in the African community is highly affected, is there any way that we can have a testing site set up at my church in Mount Moriah for those people in the African American community or people of color can come through and maybe be tested so that we can make sure with testing? Is anything like that possible?
It's something that I'd be happy to review with our mobile team. We do have a testing site adjacent to the Brace YMCA that is there Monday through Friday from 8 to 5. Also, the 18779 Novant COVID hotline, if you will. Certainly, I could work with Rhonda and the team to ask if that's a possibility. Right now, we have mobilized that unit to many of our center city communities that, to your point, Larry, has really the greatest need, really from our African American population, and working with the Michael Jordan clinics that we have operational in the inner city of Charlotte. And really, it has been overwhelming with the response that team has had. So I'll work with Rhonda and the team to work with our Charlotte company and see if we can make that happen.
Sounds good. Thank you, Roland. And I just want to do something for our community here in Matthews.
Thank you.
Actually, Commissioner Willie, I think you started a good trend since we have our kind of health folks have spoken. Why don't we ask any health-related questions to either Roland or Rhonda? Does anybody have any questions? I've got one for either. Roland, how many tests are being done in Mecklenburg County? Do you know? Or in Matthews?
Yeah, I know. I know at the medical center, I believe we've done close to 2,000 tests in the 6 weeks. I don't know if Rob or Rhonda would have, but I think it's a high number, believe it or not. And to your point, Mayor, the one thing that I believe you hear across the nation, that we know that testing is the next wave of how we're going to not only test but trace back to obviously the root cause for where some of the viruses come in, whether it's family related or so forth. So obviously, from my perspective, you probably seen in the news that May 4th, we said we're going to move forward with our elective surgical cases and imaging tests. I want to be clear to the community that when we say elective surgery, that is such what I call a lewd, kind of a large, if you will, bucket. But when we're looking at our elective surgery right now, these are patients that have placed, I would suggest, on the back burner their surgery that really needs to be done, even though it's called elective. But now we're saying we needed to move it up a little faster because greater than 6 weeks could truthfully cause harm to our patients. That being said, before you go through a surgical procedure, within 48 to 72 hours, you will be tested, and we will ask you to self-quarantine and before the surgical procedure. If you come back positive, then obviously we'll work with the surgeon as if that surgery could be delayed until the 14-day quarantine, or do we need to treat it as what I would suggest an emergency type surgical procedure, which we utilize PPE sources for all our caregivers at the bedside. So I want to make sure that the community, when they see the word elective, that they don't think that we're loosening up our criteria, because if not, it's even tighter for you to get into the door to have your surgery, assuring that the test is performed in a timely manner and that we have the results and we can work with it. So that's caused a lot of questions in our community. I thought this would be a great platform to have that tonight. But factually, tests are increasing both at our screening center adjacent to the YMCA, as well as across the greater Charlotte market.
Yeah, and those are by a doctor recommends that you be tested, correct? People just don't show up.
That's correct. If you have the signs, and as we know, the signs and symptoms today are not all the same signs and symptoms that we saw before. You know, now they've certainly, aside from difficulty breathing, now sense of smell. Obviously, the productive cough is very similar along with the temperature, but there are more and more factual findings that have actually increased that array of what the signs and symptoms were 6 weeks ago to what we're seeing factually. And then, as everyone understands, the utilization of ventilators on our patients in the early part of the phase was something that was strongly encouraged. Now, we're very, very cautious, not that we weren't before, about the utilization of ventilators, because in many cases, certainly not at Matthews or in the greater Charlotte market, they found that that was actually a hindrance to the treatment plan. So everyone also heard that the malaria drug, hydroquinone, was what was going to be the next best drug to utilize. They found that that is not true at this point in time. And the mutation of this virus is probably the fastest mutation that anyone I'm aware of that in the history has seen. That depends what you read. It's up to greater than 30 mutations, and it's not quite what we've seen of the typical flu.
Roland, do you currently have anybody hospitalized at Novant Matthews with?
Yeah, that's a great question. And 6 weeks ago, we were in the mid-30s of our 157 bed of COVID patients. In the last 10 days, we have been 5 patients or less. And in fact, as of this morning, before this call, we had 1. So it has really been, I'd say, a very significant decrease. And I'm going to applaud our citizens for social distancing, and obviously with the stay-at-home orders for that factual change. Great question. Thank you.
There are other questions for Rhonda or Roland from any of Commissioner Bland. You unmute yourself.
My greatest concern is that by backing off, or like I said, taking our foot off the gas, that we're going to encourage people to slack off. And like everybody's, we're out of the woods now, so we don't need to be as concerned about it as we did before. I think the things that you folks are talking about, the fact that we have had good results, is because people have had their foot all the way down on the gas. I'm scared to death of backing off on that. And so, that's my greatest concern. And I don't know how you guys address that or what you think about it, but that is a big concern.
No, thanks, Commissioner Bland. As you've heard from both Rhonda and I tonight, that is the factual concern that we have. I'm thanking goodness that we don't have a beach in Matthews for folks to migrate to, because we know that might be a little more treacherous. Nothing against the lakes. But to your point, I would say of the citizens and anyone on this call tonight, if you haven't really taken anything away from this initial discussion tonight, please be safe, utilize masks, distancing does matter. This virus has a knack of sometimes traveling greater than 6 feet. Cover your face, social distance. And depends what you read. It could be on this hyper caution through the rest of the summer and maybe even into the fall. So yes, by no means, even though it's a bright light right now, it's very positive. We're very hopeful that we keep doing the right thing and we won't have to utilize our significant supplies of PPE. So thanks for bringing that up again, and we totally agree with you.
Absolutely.
Any other questions?
I have 2 questions. So I was hospitalized at Novant Matthews about 20 years ago with what ended up being pneumonia, double pneumonia. At that time, Novant Matthews didn't have a pulmonary specialist, and I was transferred to Uptown. Is there that sort of treatment, that level of treatment in Matthews, or is it still transferred elsewhere?
No, great question, Renee. Thank you. And our birthday last year in August was our 25th birthday. So from my perspective, we have changed dramatically of the acuity of services we do offer. We do have an intensive care team made up of physicians and advanced practitioners that we've had for over 3 years now. That I'm going to assure the community that at least 90% of treatments can be performed at Matthews. We have about 10% do require a high level of a tertiary facility like Presbyterian. So, but at this point in time, I have all the confidence that we have not only the expertise from our providers, but also the equipment. And we certainly have had several of these patients that have spent days in our intensive care unit. And I will suggest that for all of them, they certainly have survived and got to leave our hospitals. So thank you for that clarifying question.
Okay, and then my second question is, so there are a good number of retirement communities and continued care communities here in Matthews. And when, because they have nurses, I guess, on location, are those community members going to your hospital, or are they staying in their communities and being treated in their communities?
Yeah, at this point in time, what we've seen, Renee, is I want to give a shout out to Plantation Estates that have been remarkable in their response, where they essentially locked their campus down, and I don't believe they've had one COVID patient on that campus, and that's because of their diligence with supporting social distancing as well as the coming and goings on their campus. If you exited their campus and you came back, you were in 14 days of quarantine. So at this point in time, the surrounding facilities that we work with our infection control leader on site at Matthews, along with case managers, at least the surrounding communities have done a very good job at this point in time, that they, if they have had some positives, obviously they've allowed them to stay on their campus quarantined, separated from everyone on that campus. So it is a daily check-in point that we have with these individual campuses. So kudos to them at this point in time of what we've seen with the other outbreaks across the footprint, if you will.
All right, thank you.
Thank you.
Any other questions? Commissioner Bland.
I grew up in Winston-Salem, and I get the Winston-Salem Journal and Sentinel. I noticed that they, in Winston-Salem community and Forsyth County, they have a countywide program to get I think Novant's involved in it there, and I think Baptist Hospital are all involved in it there, and trying to get everybody in the entire community to have a mask and to wear a mask. Is that something that's going on here in this area or Charlotte? Are you aware of anything like that, or possibility of something like that here in this community? Or
sure. Rhonda, you want to take that one?
Sure. We are working with our communities, all of the communities that our facilities are in, to do the Mask the Community events. We have procured masks for distribution to the community. So if we have people coming to our facility for any type of a procedure, they will be getting a mask. We're also working with our public relations that there will be masks available within the community. In the very near future, I believe it's the end of this week. I don't know, Roland, if you have a different timeline for that, but my understanding was that they would be able to provide those for community members by the end of this week.
Yeah, and obviously, I'll take today, for instance, 90% of our visitors that came through our doors that we do test before they can visit a patient, meaning ask them their questions. 90% of them already had their own mask, and that's perfectly fine. In fact, it's strongly encouraged because obviously that certainly sends a message that they walked in the building with a mask, which is what social distance is all about. So to your point, Commissioner, it's something we have to have a continuous education in our community. Now, the 10% that did not walk in with a mask, we did provide a mask for them that they could utilize. So, but it is going to take a lot of education from a continuous standpoint. So to your point, I'd like to see us replicate what they did in Winston-Salem and bring it to Charlotte.
Okay, thank you. Gave us a lot of really good information today. I'd like to encourage all of us participating in this meeting to set the example of wearing masks and certainly practicing social distancing as an example for others to do that. I didn't give two of our guests the opportunity to introduce themselves, and we'll start with Chamber President Kim Gossage first. If you want to just introduce yourself, Kim, and then maybe give us maybe an update on the business climate here and how things are going.
Sure, I'd be happy to. Mr. Mayor, thank you so much for the invitation to be a part of this, and Town Council, thank you for having me. On the whole, the businesses in Matthews are struggling. That's probably not a big surprise for anybody. We have some great success stories. One of the ones that I'm most excited about is a local screen printer who probably, absent his ability to make some quick changes, probably would have lost most of his business because of what's going on. But he's been able to make changes and start producing masks that he's selling not only locally to just families, but also to large corporations. So it's a great example of how folks in Matthews are finding ways through this and making the changes that they need to make. The challenges, though, are that not everybody has the ability to do that. Some businesses are just such that they don't have other options. The obvious ones come to mind that we've all heard about: restaurants, entertainment venues. Those are the folks, of course, who are probably taking the hardest hit. And again, I'm not telling you anything y'all don't know. Those who've been able to make quick changes to do a lot of carry out, delivery, takeout, those folks are doing quite well, or at least they're getting by. But what we're finding, or what has surprised me a bit, is not so much the obvious businesses like that, because that's who we hear about all the time on the news. But it's really the companies in Matthews that serve those businesses that I think are having the hardest time of all. They're the ones that are reaching out to us, or we're trying to reach out to them as the chamber and find ways that we can help them. A great example would be, for example, when these entertainment venues shut down, Bojangles Coliseum, easy example. And my first thought, absent my involvement with the chamber, is, okay, yeah, Bojangles Coliseum is going to lose some money over that. But what I never stopped to think about is the various companies that serve Bojangles Coliseum and the events that take place there. They're the ones who are housed right here in Matthews that are struggling badly. So it's the photographers, the videographers, the various companies that, because what they do is linked solely to these other companies or these other businesses that can't go forward, they're struggling really, really badly. I've spoken with a banker who is here in Matthews, and of course they're doing just fine. They've had a nice infusion of funds recently, but processing those PPP loans has been arduous, to put it mildly. What I understand is they weren't given a whole lot of direction or a whole lot of instruction, and of course we all know there just hasn't been enough money to go around. So the very short of it is that we do have businesses that are struggling, and the chamber is trying its very best to take care of its own, to take care of one another. Many of you should know already that one thing that we've done is put together biz briefings, which are twice weekly informative sessions that we're providing through conferences in conjunction with Central Piedmont Community College that are aimed at helping small business owners right where they are. I will tell you all, as a small business owner, it's one thing when you take a hit and your business takes a hit, but when you start talking about furloughing or laying off employees, that's when this whole thing really, honestly, just kind of pulls the rug out from under you, especially if your business is small and everybody's family. So we're trying to do what we can to help that, to get information out in front of people, and now we're starting to make plans for how can we position the town of Matthews and our chamber members for the reentry. And when some of these things start to be lifted, it sounds like it'll be a gradual lifting, but how can we help our chamber members be in the best place and encourage folks to shop locally, to keep their money as locally as possible so we can get through this? So I hope that I don't want it to be a discouraging report, but the reality is it's a little bit discouraging. The businesses that you expect to be struggling are struggling really badly, and there's every indication that some of them probably aren't going to come out of this. But others have been able to make that quick change and are doing quite well.
Kim, do you have a feel for what percentage of chamber members that applied for the small business loans were able to get them?
We sent out a survey recently. The response rate wasn't high enough that I really have a whole lot of confidence in the number. What we found, though, is that the majority of those who responded had, in fact, applied. And at that point, the majority of those who had applied had received some form of funding, not just PPP, but also the EIDL. the emergency disaster relief. I'm not going to get all the title correct on that. So what we're finding is, yes, Mayor, there are quite a few who have applied and have received the funding. But I'm also, in talking to somebody from First Citizens, they ran out of money just practically as quickly as they could put it in the bank. So a lot of folks, and frankly, my business included, are sitting here waiting for the next round of funding to come through so we can get our applications in.
Does anybody have any questions for Ms. Gossage?
I've seen on many larger businesses like Facebook, the U.S. Chamber of Commerce, I can't remember, 10 or so businesses offering loans or grants for businesses. Is the chamber getting information like that out to the public?
Yes, ma'am, we absolutely are. We're getting it out to the public, and we also are doing our best as the chamber to take advantage of it to benefit the chamber. The reality is when these businesses are struggling, they're not able to pay dues. A large percent of our income comes from events as well, and we're not able to host events. So our income as the chamber has taken a nosedive as well. Can you all hear that helicopter that's going over me right now? I'm sorry. I live real close to an airport, and that's what I deal with all the time. So yes, ma'am, we are seeing that some of our members are able to take care of grants. Most of them are very small grants, between 1,000 and 5,000, and the chamber's been able to apply for and receive a couple of those as well. I know one in particular came from Duke Energy.
Okay, good.
Okay, and finally, we'll move on to Mecklenburg County Commissioner and my fellow South Mecklenburg alumnus, Susan Rodriguez McDowell. Susan, can you give us a perspective from the county?
Yeah. Hey, thanks for having me tonight, you guys. It's great to be here with you. As far as I know, what's happening right now with the county is, as you know, the 29th is sort of the end of what we had for our order. And then the governor extended to May 8th. And so I know that what's being talked about right now is a real side-by-side comparison between the two orders and looking at that real closely and making decisions on what the recommendation will be as far as going forward from the 29th. And so I know that I'm looking forward to seeing what staff's going to come up with as far as a recommendation on that tomorrow. I'm expecting that tomorrow. But, just from my perspective, I'm just really sensitive to the fact that, every hour, every day, every week that goes by where businesses can't operate is causing, just terrible disruption for folks. And, but I'm also really sensitive to the fact that, we really need to be ready to reopen. And in my mind, like Commissioner Bland said, about the PPEs and having enough masks for folks. I mean, if you think about how many people really need you need to have a couple of masks, so that you can wash them and change them out. So if you're going to be out in the public, we really need to be able to have access to those masks for the public. And so, I'm thinking about elderly folks, they don't have bandanas sitting around maybe, or, how do we ramp up so that everybody has access to PPE that they need? And then also the contact tracing. I'm really interested to find out where we stand with that as far as how ready we are to take that on. I know my husband was diagnosed or was tested back on St. Patrick's Day. And it took 8 days for us to get his test result. And then when we found out, we did get a phone call saying, okay, kind of where have you been? And they didn't really find out what airplane he was on, who he really came into contact with. And so I'm really interested to see how are we going to do contact tracing? What's that going to look like? How robust is that going to be? But, and having those tests ready, more testing available for folks. But, most of all, I'm just looking at, I just have great hope that we're going to come through this crisis better than we were before. I think it's an opportunity. It's an opportunity for us to see where we've fallen short as a community and how we can come back stronger. And so that's kind of what I've been doing. It seems like a 24/7 job these days. I'm sure you guys feel the same way. A lot of folks are hurting, and a lot of folks, they need leadership right now. And so, so thank you for having me tonight. And if there's any questions that I can answer, I'll happy to do so.
Thank you, Susan. I can really appreciate your perspective, and I think all of us have said this at one time or another, but there's nothing else in my lifetime that even remotely comes close to this experience. Yeah. I guess the closest thing would be the AIDS crisis in the 80s, but nothing of this magnitude. It's truly life-changing, and I think we are forever going to be different when this is over. Even from something as simple as I heard the other day that handshaking will probably be a thing of the past. That will no longer be socially acceptable to touch somebody when you greet them. So my wife has suggested that we do jazz hands. I don't know if that'll work, but it truly is it's a life-changing, once in a lifetime event. And I'm hopeful we do come through better for the experience or get some silver lining out of this cloud that's enveloped us right now. Does anybody have any questions for Susan? Does anybody have any questions for any of our guests? Commissioner Miller, I think you're muted if you're speaking.
Mayor, are we going to discuss the stay-at-home order later in item number 7 versus now on 5?
Yes.
Okay, I'll hold my comments.
But I mean, you're welcome to ask any of our guests a question concerning the stay-at-home order if you like.
No, I'll save it. Well, yeah, I'll save it.
I'd like to ask about testing, and I haven't heard a lot about testing lately, but for a long time that we were hearing there wasn't enough, and that it's slow to find out whether you have a positive or not. So have we caught up with that? Is there ample testing on hand?
Yeah, Renee, I'll take that and ask Rhonda to chime in. In the 6 weeks ago, we had a challenge at the medical center for the amount. We had to be very careful, if you will, with the signs and symptoms that we just didn't test everyone walking through the door. Since then, we went through 4 to 5 companies that they had said that they had the ample testing available. 2 or 3 of them we decided not to go with because they had too many either false negatives or false positives. And we wanted it as close to 90, I'd say 99 to 100%. 100% would be preferable. I would suggest at this point in time that we're okay as far as the testing availability. Now, when I say okay, that probably doesn't warm your heart, but I don't want to say we have millions that are disposable for testing. That would be short-sighted, but I believe that we do at this point in time, short of something of the magnitude of New York City, for instance. But I believe moving forward, we have ample to test our surgical patients coming in, our individuals in our practices, as well as in our emergency room. That being said, I'm going to throw out some caution that we need much more. So what you hear at the national level, we can validate at the local level that we must improve the testing capability as well as the tracing, as Susan noted, because without that, we're still throwing darts at a dartboard at this point in time. We can get close, but I don't think it's good. Heck, it's not good enough. So time will tell as our companies continue to ramp up. I am hopeful that the federal government will continue to push hard with war-like times that all the bells and whistles are shut off and we need as much as you can produce as if we needed it yesterday for today and tomorrow. So hopefully that answered your question, but we're not there yet, but we're better than we were 6 weeks ago. I'll say that as a personal testimony for the medical center.
That's absolutely correct, Roland. We have seen dramatic improvement in the turnaround time for the tests that we've actually been taking. So Susan, to your example with your family member taking 8 days to get a test result back, those times have been ramped up quite a bit. We obviously would like them sooner rather than later. We have opportunities sooner rather than later. So we've seen a great supply come to us, but to Roland's point, not where we think we should be. We still have some caution when we're doing our testing to make sure it's truly that we're appropriate and using the best resources for that. So
I have a question.
Yeah, I got one, John.
Commissioner Whitley, go ahead.
Roland, I'm hearing something about a portable testing where you test yourself and mail it in. How credible is that? I think I saw something maybe $100 per unit.
$119 on Amazon. $119 on Amazon.
Is that a credible testing unit?
So as of right now, I don't have the specifics on that test to be able to say whether the specificity is enough to truly be accurate in the diagnosis. We're still using the symptomology, the symptoms that we talked about earlier, along with the diagnosis. All of these tests have been given the emergency waiver to be used for this. So it's not going to be 100% accurate because these tests were just very quickly developed. They do have some very high reliability, but they also have not been, quote unquote, proven to the regular FDA requirements for what we would expect for testing. So we've included symptomology for all of the testing that we do, as well for our patients, especially the ones in the hospital, to make sure that the physicians are making the best clinical decisions for our patients.
So Larry, I would suggest too soon to tell.
Exactly.
We're definitely not going to put our stamp of approval at this point in time, just because we don't have enough data. I always said the home test, some are better than others, whether you have a pregnancy test or are you looking for a positive stool specimen. So again, now I don't think either one of us are going to say we're ready to give it a stamp of approval at this point in time, and stay with our 99 to 100% efficacy at this point. Good question, though. Thank you.
Mm-hmm.
Thank you.
For those in our community that are told they need to go get a test, what should they expect? Is it like a strep throat test? It's a swab of the back of your throat. Is that what it is? Is that what the protocol is?
So currently we're doing nasopharyngeal and oropharyngeal swabs. So it's a swab that goes very far back in as far as collecting. So the actual specimen collection. I saw that wince. That's about the truth. That is true. So it's not the most comfortable test in the world, but in order to get the adequate specimen to test, we really have done a lot with education and making sure people understand why we're having to do it the way we do.
Thank you. Commissioner Miller, did you have a comment?
Yes, I had a question, please, for Roland. Roland, I believe I heard you say that you've seen a 10-day decrease in COVID patients and that currently you only have one. Is that accurate in the?
Yes, sir. Correct.
And I believe one of the measures or the metrics nationwide and statewide is a 2-week decrease before they lift some of the restrictions, not lifting social distancing, but some of the other restrictions. Is that accurate?
You're correct. 2 for 2, Commissioner Miller.
In my note-taking, Hazen stated, I believe we have 34 people affected with the COVID virus in the town of Matthews. Hazen, is that correct? 34?
Yes, sir.
Thank you. and our population is roughly 30,000 people. I did the calculator math on that. It's not 5%, it's not 3, 2, or 1%. It's not 0.5%. It's 0.1% of the town of Matthews has been affected by COVID-19 currently, and it's trending down for the last 10 days. I just want to fight for the businesses of Matthews. South Carolina is opening up, according to what I heard yesterday. I don't think it changed today. And we have a number of businesses with courtyards or outdoor dining where social distancing can be respected, employees with masks, customers with masks, social distancing, things like that. And so I feel optimistic that we're trending in the right direction. I'll stop.
Yep. We would agree with you, Jeff. And I think, again, in normal circumstances, I believe it's an excellent path. I think as we certainly have chatted tonight, the largest concern is that when people hear we're getting back to normal, they forget what we've went through for the last 6 weeks and they truly go back to normal. So that's always the caution that we throw out. And what we've seen at the medical center, we don't treat just patients from Matthews. 35% of our business comes from Union County. So that is the biggest challenge that we've seen in our medical center. And obviously, as we know with Matthews, businesses do attract outside of Matthews. So I think the town of Matthews has done a great job from a citizen's response. I would think the challenge would be for those that haven't quite been as good in social distancing as the town of Matthews. So definitely I want to continue to your point. I think it may be good moving forward to lighten some of the restrictions, but the mayor said earlier, if we see a fallback that people are not paying attention to it, a fallback, then unfortunately we'll take a couple of steps back and we'll have to invoke increased leverage of the stay at home. So to your point, it's not a clear answer. And I think Commissioner Urban he's got his hand raised too. Yes, sir.
Roland, this is for you. Obviously, it's a multiple part question, but can you talk to, is anything going on in Mecklenburg County or the state of North Carolina on the antibody testing? Because obviously we see studies coming out of Stanford and other places that are looking at the data differently. They're getting castigated for it, but I can sort of say through anecdotal evidence, I've talked to a lot of people that in February and March said, man, I've had all those sort of symptoms. I felt really miserable for 10 days. I hung out, I took the test, but the test didn't come back for 8 or 9 days. I was fine after the fact. Is there any antibody testing going on, and is there any validity to the fact that this may be going around more so than we actually think?
Yeah, and thanks. And I'm going to kick it to Rhonda because we're fortunate. Novant Health is part of that trial testing, if you will. And we may, if the town of Matthews deems us the privilege, we'll post something to your website in regards to those trials that are ongoing in Novant Health at this point in time, with what we hope that we'll find via some of these trials adequate treatment. So Rhonda, you want to expound on that a little more?
Sure. So there's been a lot of involvement with Novant, as Roland mentioned, and what we're finding is that that's still part of the ongoing evolution of determining what we know about this organism. So some people that have had no symptoms whatsoever have had very low, if no detectable antigen levels at all. So there's still some interpretation that they're having to come up with before they can actually move that testing forward for antigen testing. We are very involved with the companies that are working on that, as we are with several trials in the state of North Carolina for treatments. So we're on the cutting edge for that. We just don't have a definitive answer as of right now. But yes, that we do feel is coming and will be an industry standard before too long.
Commissioner Bland?
isn't really the biggest problem is that there's so many people out there that don't even know they've got it. And like the time when it is the most contagious is before even people that get sick, show any symptoms. I mean, that's what makes this disease so deadly as opposed to a lot of other diseases. I mean, we're talking about, we've done a lot more testing than some places, but in the town of Matthews, if there's 35,000 people and even on 1%, how many people out there are walking around with it that don't know that they're spreading it around? So that's my big concern. It's like I expressed to the mayor the other day. I picked up a meal downtown Matthews, and I was like looking around, and there's a lot of young people out there who I guess they think they're bulletproof, and they're all out there walking. I mean, big groups, certainly not practicing social distancing and not using any kind of mask or gloves. And I was sitting there thinking, wow, they must not have gotten the memo. But
Sure.
It's a serious disease.
It is, and I thank you for bringing that part up, and that's part of the reservations with the social distancing and making sure that they understand that what we've been able to do so far is because they have been helpful and have followed what public health and recommendations have been across the area, and the transient, once they lift it, that travel is able to be reinstated to the stay-at-home order lifted, so to speak, then we do expect that with Rowan having more cases than the area of Matthews, that there's a potential Union County, Cabarrus County have had more cases as well. So that is a concern for us as a system as well.
Yeah, and Dave, to add to that, I think when I'm in a forum that I get asked that same question, I said that younger generation may be bulletproof. But how about when they visit their grandparents or their mom and dad that do have a risk with a comorbidity, then all bets are off then. And I think what I'd like to stress, it's not just about them. Mm-hmm. It's about who they come in contact with. And that's where we've seen 90% of the individuals will have flu-like symptoms and they'll move on. It's the 10% that we have the greatest concern with. And then if you have comorbidities, high blood pressure, heart disease, I could go on, you are at significant risk. And this isn't just the routine flu. So to your point, younger is great, but it doesn't mean you can't move it down the chain of those that you come in contact with. So thanks. Great point.
Well, I certainly want to thank all of our guests for joining us tonight. It's been very informative, and you've given us all of your unique and expert perspectives, and we very much appreciate it. So thank you.
Thanks for having us.
Thank you.
Thank you.
Hey, Roland.
Thank you.
All right, we're going to move on to the public comment agenda item number 6, and I'm going to ask our town clerk, Lori Canapino, to read the public comments that we've received.
Thank you, Mayor. We are going to be sharing a document that one of our public commenters has provided to you as I read his comment. One moment, please. Okay. This first comment is from Mr. Todd Fuller. He says, "Good evening. Thank you to Mayor Higdon and the commissioners for allowing me to present to you this evening. Thanks as well to Lori Canapino, who was helpful answering questions about the meeting. My name is Todd Fuller. I have a degree in applied mathematics and a master's in analytics, both from North Carolina State University. I was a graduate of NC State's Institute of Advanced Analytics, the nation's first Master of Science program in analytics. I also hold several analytics certifications, such as Predictive Modeler through SAS. SAS is an analytics software firm headquartered in Cary, outside of Raleigh. In the next few minutes, I will show 2 reasons why analytics support that it is a good time to safely begin a reopening of Matthews and, frankly, Mecklenburg County. This first slide shows that stay-at-home orders have had no additional effect of keeping us at home beyond other measures prior to March 26th. As you know, the order began March 26th. The black line on this graph is the percentage of county residents staying at home. This is based on mobile device movement and is provided by the University of Maryland's COVID-19 Impact Analysis Platform. Please note that the black line was trending up, green arrow, starting on or about March 12th. Several targeted measures were deployed weeks prior to March 26 and are noted on the graph. The purple line shows the trend since the stay-at-home order began. Pre-pandemic, just under 1 in 5 residents stayed at home. However, in the days prior to March 26, about 35% were staying at home. That percentage has not materially changed since March 26th and through April 23rd. It is noteworthy to mention that the county uses Google Mobility, whose data lag by about 2 weeks. Google Mobility reveals the same conclusion across retail, residential, and other sectors. Next slide, please. The media constantly reports that the total cases many times a day, for example, 1,407 a couple days ago. What matters is the number of new cases. Total cases are becoming increasingly irrelevant with each day as cases resolve. New cases each day are important because they could drive hospitalizations. But as important are the new cases is the new case growth rate. Like a race car, its ability to win a race is not just dependent upon its speed at any moment in time. Rather, its ability to win or lose is also determined by its ability to accelerate or not. Acceleration to a race car is new case growth rate. Long before stay-at-home orders began, the new case growth rate has been in steady decline. True, the race car has speed and can continue to add daily new cases, but the new cases being added are not increasing. New cases are flat or decreasing because the growth rate is in overall decline. The 2 blue arrows show the overall trends. The chart on the right starts April 2nd, representing the stay-at-home order time period, taking into consideration time from infection to showing symptoms and 2 days for test results to return, about a week total. With occasional zigs and zags, the overall trend for both time periods has been a slow, steady decrease. We can expect to continue to pick up new cases in the short term. However, neither trend indicates a new daily cases will accelerate, nor that stay-at-home orders were effective at steepening the new case growth rates decline. Thank you for your time. Please feel free to contact me with questions. And I have Mr. Fuller's contact information if any of you have the desire to reach out to him.
Very interesting.
Thank you, Lori. Do we have any other comments?
We do have one other comment from Mr. Adam Reed. His comment is as follows. All, thank you for the continued hard work and diligent support for the town, its citizens, and businesses. We know everyone is balancing what's best for both our downtown businesses and the public. While we support most measures that encourage public safety in the downtown area, there are times when some measures cripple downtown businesses' ability to operate in any normalcy. We recognize that the intersection at Matthews Station needs improvement. However, we are all aware of the hard times every business is going through right now. The fight for survival is real. The added pressure of closing the street would be too much. I remember vividly when a few years back, the railroad company completely closed the intersection on North Trade Street for 2 weeks. Our business and several others ground to a halt. We closed and decided to take an unscheduled vacation because no one would intentionally drive into downtown. For those unaware who attempted to drive through downtown, traffic was a mess as drivers did abrupt U-turns in the street and frustrations ran high. People adapt quickly. As soon as drivers became aware of the closure, they avoided downtown completely, and street configurations have not changed. Under the current situation, thankfully, people are willing to drive into town to support businesses. If that is made to be a challenge, they simply will not come. I know that for a fact because that is exactly what happened before. That is why I strongly oppose measures to restrict traffic flow too much. We urge you to consider measures that keep the street open. Matthews is becoming a destination for people to gather. We don't want to be discouraging that. If it's possible to push this off to next summer, I'm sure several of the businesses could plan accordingly and traffic will be slow as people are on vacation. I don't know if a project like this can be done during the summer months, but that would be more favorable. Thank you in advance for your consideration. Be well in Sante. Signed, Adam and Veronica Reed of Sante Restaurant.
Thank you, Lori. Do we have any other comments, public comments?
There are no other public comments, Mr. Mayor.
Okay, thank you. So we're going to move on to item 7. I'm going to turn it over to Hazen in a moment to discuss the consideration of a letter regarding the stay-at-home order, but I wanted to give it some perspective first because there's been a whole lot of misinformation about, what my stance has been and some of the other mayors in Mecklenburg County. So I want to kind of give this idea some perspective. And I believe most of the commissioners know this, but for those in the public that are watching this meeting, I want to make sure they understand what my stance is. So most are probably currently aware that there are 2 stay-at-home orders. There is one for Mecklenburg County, which is much more restrictive than the one the rest of the state abides by, and that's the governor's order. So the last emergency declaration that I signed was set to expire April 29th. But there is a clause in the order that allows the county manager to continue using the current order as long as the governor has an order. Well, like most of you, I've been receiving a lot of emails and calls from some of our small business owners that are, quite frankly, as Ms. Gossett said earlier, are on the verge of closing and never opening again. They're really, really hurting economically. So I spoke with some of the other mayors in the county. I've actually talked to all of them. I spoke to Mayor Wiles as recently as a couple hours ago. But five of the seven mayors in Mecklenburg County, the only ones that don't have this thought are Charlotte and Davidson. But the other mayors from the other towns, Cornelius, Mint Hill, Pineville, Matthews, who am I missing? We've all been hearing a lot of the complaints from some of our businesses, and it's my opinion that, so first of all, what we have proposed is that we adopt the Governor Cooper's order effective April 29th when the current one expires. And what this would do is it would allow some of our currently deemed non-essential businesses to write to the North Carolina Department of Revenue and request that they be allowed to open if they follow proper safety precautions, including social distancing, masks, gloves, curbside pickup, et cetera, et cetera. What's a little frustrating to me is I hate to see the big box stores in Matthews, which are certainly important partners to our community, but I hate to see them reap record profits while some of our other smaller retailers are going to go belly up if we don't help them out pretty soon. So I would like to send a letter tomorrow, and we're going to wait till tomorrow. If this passes, I'm going to call for a vote on this because the county is considering lessening their current restrictions a little bit. Commissioner Susan mentioned that that is a possibility that the county may lessen their current restrictions, and we're going to wait, give them the opportunity to see what they're willing to do. But if we went along with the governor's plan, this would allow us to, some of our businesses to open and again follow all the safety protocols that everybody else has to follow. This letter, and my intent is absolutely not to liberate North Carolina or open all businesses and open all of our restaurants and et cetera. And I've had probably 10 phone calls today that suggested that was my intent, and not at all. We want to follow Governor Cooper's order, which is still very restrictive. It's going to be phased over many, many weeks, months actually, before things can open again. But this would give some of our smaller retailers the opportunity to open and start earning some money and pay some of their bills. Right now, the Walmarts, Targets, Home Depot, Costco, and Lowe's are the only game in town, and some grocery stores and large pharmacy chains. And everybody else is just out of luck. And what my frustration is a lot of these larger retailers sell the same items some of our smaller retailers do. So I'm going to open this up for discussion. I've polled each of you. I've talked to each of you at length, most of you more than once about this. But I for sure, absolutely want to make sure that the public understands that I am absolutely not suggesting that Matthews open up and disregard the governor's order or anything of that nature. I'm saying let's open up some select businesses that have been vetted by the state. It would give them a right to open and sell things. And I've used my friend Carol Bowie Jackson as an example many times. I hope she doesn't mind, but here's a retailer in Charlotte that has 2 birdseed stores, Wildology and Birdhouse on the Greenway. She is operating by advertising on Facebook. You call her, you give her your credit card number, and you drive in front of her business, and she places the items you've purchased in your trunk. It's almost a contactless method of doing business. And I don't see why other retailers couldn't do something similar. Right now, under the Mecklenburg County's restrictions, they are not allowed to operate, period, no matter what they do. They just can't operate. So it's with a great abundance of caution that we would do this. We would want to enforce this and make sure that it wasn't being abused. But I would like to adopt the governor's plan effective April 29th, and May 8th we would do, if everything trends in the correct manner, we would go on to the phased reopening that Governor Cooper has discussed. So I'm not saying open up. I'm saying let's go along with the governor's less restrictive plan than the really, really, really tight one that we have here. And I feel this is the right thing to do, and I'm somewhat emboldened by some of the trends that I'm seeing. We're certainly not out of the woods. We still need to be careful. We need to consider all the safety precautions, but I think it's time now that we allow some of our businesses that can operate safely to operate. So now, let's just open this up for discussion. I'll let anybody that would like to talk about it say your piece, and then we're going to put this to a vote. And if the majority approves, we will send this to the county tomorrow after they've met, if they haven't lessened their restrictions or done some other sort of compromise. So would anybody like to comment on this? I'm sorry, Hazen, did you want to add to what I just said?
I don't have anything to add. I'll be happy to answer any questions, but I thought you did a good job summarizing it.
Mayor?
Yes, sir.
Is the comparison between Mecklenburg County and the state part of the agenda?
The agenda for tonight's meeting?
Yes, sir.
It certainly can be. I sent a factual sheet that had all those differences to each of you to review.
Right. That was a very, very valuable comparison. I think that should be part of the record of tonight's meeting. I studied it at length, and there were a couple comments I would make on it. If it is going out, there's a few minor typos that I don't need to call to your attention on here right now. But I would suggest it be part of a document that would go out after the typos are addressed or the whatever. I had a question. It didn't address child care or daycare, and the hotels and motels are implying that they're two different colors and that they're different.
Right.
They're being addressed differently, but it's the same verbiage.
And they're the same. That was an error. And that document came from the county. That's not my document. But yes, I noted that the verbiage is identical for hotels and motels. So I don't think there's any difference between Mecklenburg County and the state's requirements for motels and hotels.
Okay, very good. But I think that was a valuable document to share.
So would anybody else care to add to the discussion?
I will.
Nope.
Commissioner Bland.
I just like to say, I'm very, very cautious, but I do sympathize and empathize, and I'd like to see us give our businesses an opportunity to show that they can act responsibly and do this, okay? I mean, what we've talked about tonight is the fact that, the town of Matthews has done a pretty good job, you know what I'm saying, overall, okay? But what I'm concerned about is maybe folks around us who haven't done quite as good a job creating problems. I think we need to lead by example, but we need to, at the same time, police ourselves. And if we're not doing a good job, then I would certainly be the first person to say we need to crack down, get back to the thing, put our foot all the way down on the pedal. That's sort of, I'm forgiving people. I understand the pain people are going through, and I don't believe in subjecting people to unnecessary pain. But, we can't sacrifice the public's health and well-being just because we're having a tough time. Everybody's having a tough time. That's my point.
Mr. Blodgett, or I'm sorry, Town Manager Blodgett, would you like to say something? Were you?
Yes, Mr. Mayor, members of the board. One of the things it is, so I am part of a policy group that meets every day at 10 o'clock. And I guess I would just like to reiterate to this board that great folks on that, great leadership by the county manager, Dina Diorio. And I would say to a person, everybody understands this tug of safety, health and safety, and economic vitality. And so we are going to have another discussion about this tomorrow at 10 o'clock. The ideal situation would be for the entire county, all 8 jurisdictions, to move together as a unit. I do know our police chief has expressed some concern to me. If we peel away, let's say next week, we peel away from Mecklenburg counties and just go with the state of North Carolina, then the guiding force is the Department of Revenue. And there was discussion on the meeting today at 10, and let me just finish that thought. And Chief Pennington he didn't say it's impossible, just remember that's a kind of a cumbersome thing that we will have to work through probably for a week. I'm assuming if the county stayed on its current path, they would eventually go to the governor's plan on the 8th or 9th, but there's no guarantees of that. They haven't said that. So I would ask, if the board does vote to support this, that we not, publicize this, or whatever the right word would be, until after the meeting tomorrow. I think the county commissioners have a meeting tomorrow afternoon to see if there is a middle ground, because I do think we would all work better at over 1.1 million people to trudge along as a unit. I think everybody recognizes we may have to back up. If things aren't successful, there are a lot of metrics out there that can be measured and ticked off, and the potential's there. But I do want to make this group rest assured there are great people evaluating the situation. Both hospitals are very good in trying to guide all of us through this.
Absolutely concur with those comments.
I'd like to make a comment too. And I think that waiting until after we hear from the county tomorrow before moving ahead with anything is a wise decision, because having a cohesive voice is going to be invaluable moving forward. Using the big box stores as an example, I feel like can also work in the opposite direction. Because the reason the big box stores are having so much success is because people are going in and buying non-essentials. Those are people pushing the boundaries and pushing the lines of what is acceptable and what's not. They get tired of being at home, so they can go to Target and walk around and look at camping gear, right? So those aren't the people who are making these big box stores the success aren't necessarily the ones who are following the rules and doing what we should be doing. On the same line as towns, and we all discuss, how we move forward and whether that agrees with what the county says or not, the county is the one that's looking at the data on public health and the impact of public health. And as town commissioners, we don't have that data that they're looking at, and we can't analyze what they're seeing. So maybe our hospitals in Matthews are not seeing the uptick, but certainly there are clusters of outbreaks in places that we aren't seeing firsthand, and they're not in the hospitals. So today, earlier, when I was out, I saw up at Stumptown Park, I saw 10 or 12 guys in their 20s playing football in the volleyball court. They were not social distancing. They were not wearing masks, and they were passing a ball back and forth. The police were there when I kept driving around to see what was going to happen. The police stopped, talked to the guys. The police left. 10 minutes later, they were still out there playing football. They weren't listening to what the police asked them to do. The group didn't break up. And so if we're asking, for our emergency services to take on this added task of ensuring that social distancing and proper precautions are in place, then we're going to really need to ramp up what their abilities are and their staff manpower is going to be, because we're out in the middle of the open. If 10 or 12 guys are playing football, imagine what's going to happen in any sort of the shopping centers in town.
Thank you. I will remind this board that we do get the county dashboard regularly, and Roland said he is updated every 4 hours on the COVID, what the current state is. So I think we do have access to a lot of information, certainly not all of it.
We don't have
that
micro data that they're really looking at.
Okay, I'll grant you that. I think this is a small step. It's a cracking of the door. It's something that we can react to quickly if it for some reason goes south. I don't personally think it will. I'm optimistic that we could do this. It's again cracking the door. It's just allowing a few more businesses to open. It's not we're wide open and everybody's acting like we're back to January. Certainly not that.
Mayor, I got a question for you.
Yes, sir.
And I listened real carefully. Even if we agree to April the 29th, and these non-essential business file to the governor to do that, that's not assurance that the Raleigh is going to give them permission to do so. Am I correct?
You are correct, although I've heard that a strong 80+% are granted the right. So some are denied. But a good portion are, and it's done on the faith that they're going to operate in a wise manner. I think our public is much more attuned to what's, by and large, the exceptions that Mayor Pro Tem Garner just mentioned. Most of our folks, when I go to the grocery store, I see people wearing masks. I see people practicing social distancing. And a lot of these businesses could operate with curbside pickup where people aren't even coming into their stores. They're just allowed to open and sell stuff and make some money so they can pay their bills. So I think it's a slight opening of the door, allows a few more of our businesses to operate, and it's a very measured approach. And then hopefully by May 8th, the governor's full program of a three-part phase 3 opening will start. And that's a very cautious, well thought out program. Again, very measured, and if certain metrics aren't made, then you don't move to the next phase. So I think this is a reasonable compromise. I don't think we're asking for something dramatically different than the current state. Just allow a few of our businesses to open that are struggling so much right now.
And I concur with what you're saying, and I saw the data. My only concern is that my church is right in the middle of the African community, and I do not feel we have had enough testing of people of color. I know the numbers that we talked about for Matthews, they stayed down, and it could be because we haven't done enough testing in Matthews. I see both sides of what you're saying, and me, you've been through a lot of conversation today and yesterday. On one hand, I know what you're saying. On the other hand, we're 10 days from what Roland showed us that we're on the down curve, and the governor's asked for 14 days down curve. We are 11 days away from May 8th, and my wishes are what I feel. We've been in this thing for 6 weeks. We less than 2 weeks from May 8th. At May 8th, if I see what South Carolina, Gastonia, and Atlanta, what their numbers look when they lift up stuff, I would be more susceptible, because Matthews have been afforded, been blessed that we didn't have a lot of cases and hospital stay. Dave Bland is right when he said, I know people been shut up so long, and they get out, they're going to be free. And I want people to be able to come out, and then stages like we shut down, lift us back up, and we gradually go back up. So that's my 2 cents. But I see both sides, and I see what you're saying, and I saw the data, and that helped me a whole lot tonight to see. Mine is more concerned with the African American community not being tested. And I don't think we have the right numbers in that poll that we can see that my church and my community, because a lot of my church members live in Union County, and that's what Roland said. A lot of the patients in the hospital come from Union County. Union County numbers not as good as Matthews. So that's my 2 cents.
Okay, and I again wanted to be clear, I'm not advocating what South Carolina or Georgia did, which is essentially lift all restrictions. No way doing that. Very measured approach.
I understand. I concur with you what you're saying. I know exactly what you were asking, and that's nothing like neither one of those or Gaston. So I concur with that.
Commissioner McCool.
I just want to be sure if this measure passes that we're extremely, extremely cautious, and we keep a very open dialogue with our healthcare officials and professionals that, if we start to see trends that are going in the wrong direction, that we can be able to get together and, get stricter restrictions. I think this is a good start, but we need to be absolutely sure that the health of the people is foremost, but we're also talking about people's livelihoods too. And so I'm with Larry. I see both sides, and it's honestly something that's been weighing on me quite heavily. So I like the numbers that Novon is seeing. I'm excited by those numbers, but Dave said, are we supposed to take the foot off the gas? It is a tough decision, and it's weighing on each and every one of us, I think, very, very strongly. And I'm excited about what the governor has to say, and I like what the governor has to say. So that's my little spiel.
Okay, thank you. I think we all realize that there's never going to be a point where there's absolutely zero risk. To do that, we would stay closed till there were no more cases. If you want zero risk of of anything possibly happening, and I just don't think that's reasonable. So we have to take some risk. I think this is a very measured, minor step in that direction to help our businesses. Would anybody else like to make a comment before I call for a vote? Commissioner Urban.
Mr. Mayor, thank you. I mean, obviously we can't fix stupid. I mean, if you got 10 people not practicing social distancing, et cetera, that's just not smart, period, bottom line. But I am one for freedom of choice. I think that our rights are being trampled upon, obviously, in a lot of this, because frankly, there are people missing opportunities to get elective surgeries that are important, suicide rates going up, blah, 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 blah. But I think this is such a minuscule step that it's a whole harmless situation. The reality is, if these additional businesses on this list, they have every bit of their freedom of choice to open if they want to open. At the same time, the patrons have their freedom of choice as to whether or not they want to elect to choose to patronize that store. So if you feel that you have a higher susceptibility to this virus, don't go to one of these businesses. If you are a business that is very fearful of what could potentially be harmful to them, don't open. But I think what you're asking for is a minor lift in the situation, and the ultimate thing is that both the owner of the business and the patron of the business still have their freedom of choice to elect whether or not they want to proceed with their decision.
Agree.
Okay, again, I understand this is a difficult decision. Again, I think it's reasonable, and if there's no other comments, I'm going to call for a vote. We weren't necessarily going to vote on this, but I think it's such an important step that I would like to go with the majority of the board, and not just, it shouldn't be a decision that the mayor makes. It should be something that all of our elected officials make. I have one vote like the rest of you. So
can I ask a quick question to
Sure.
Charlie?
Sure.
what is the legality of us, if we vote yes and trends just skyrocket, cases skyrocket, could we meet same day to have a vote to go back with Mecklenburg County or in some aspects, is that a possibility?
Commissioner McCool, we can always, as a board, put in something more strict than the state. We could close all of our businesses immediately if we call a special meeting. So we can always be more strict. We just can't be less stringent than the state.
So we do have to notice the meeting. Is that correct?
A 6-hour notice.
That was my question.
6-hour emergency.
So in 6 hours, we could close the whole town down if we had an issue. But so we can always go more strict, and that's been my frustration. Is there's so many people calling me saying you're lifting all of the restrictions and they're just going to open everything up in Matthews, and that's not allowed. I'm not sure how Gaston County is going to deal with that, but we at the very least must comply with the governor's order because she's the governor. We can be more strict than the governor, and that's what Mecklenburg County has decided to do, to put in additional restrictions. And I'm just saying, let's go with what the governor, what's good for all the other counties in North Carolina. So any other commentary before we call for this vote?
Yes. One thing, are we doing this contingent upon waiting to see? Say we voted to support it, but the county does something or comes with something tomorrow, and we think that we need to, reconsider. We can certainly do that.
What this vote does is allow me to sign this letter and send it to the county if they don't, lessen their restrictions to our satisfaction. And I'm aware that, as Susan stated earlier, that the county is looking at that. I know that they're already talking about lessening some of the park closures they have. They're going to, another example is realtors. Realtors right now under the county order cannot sell houses by showing a house in Mecklenburg County. Think about that for a minute. No houses can be shown in Mecklenburg County. So that's something that we're hopeful that they're going to address. I think they are going to probably address the realtor situation. But that's a perfect example. Actually, that's probably half of the phone calls I've got are from realtors that are concerned that their livelihood's been cut off. Difficult to sell a house if you can't show it. Mm-hmm. So what I need right now is for someone to make a motion, and the motion would be to authorize the mayor to sign this letter and send it to the county tomorrow after they've met. And Hazen and I talk multiple times daily, but give an update as to what they have changed in their ordinance, if anything. Correct.
I'll take that motion.
Second.
So we have a motion from Commissioner Miller. Who seconded it?
Me.
Seconded by Commissioner Urban. So again, I'm going to ask, something tells me this is not going to be unanimous, but we're going to try. All in favor indicate by raising your hand and saying aye.
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 Who all do it again? Okay, we have, I'm going to call roll, so it's going to be a 4-3 vote. So I'll call each of your names and indicate yay or nay. Mayor Pro Tem Garner.
Nay.
Okay, Commissioner Bland.
Aye.
Commissioner Urban.
Aye.
Commissioner Whitley.
You're
on mute. You're on mute.
Unmute.
No at this time.
Okay. Commissioner Miller.
Yes.
Commissioner McCool.
Nay.
Okay, that passes 4-3. So thank you. I know that was a very difficult thing to consider, and hopefully there'll be some good compromise with the county, and maybe we won't have to go down this path. So appreciate everybody. I appreciate everybody debating this respectfully. I know it's a very difficult topic for all of us, and I'm glad that our board can agree to disagree and move on. So thank you. I'd like to move on to agenda item 8, the consent agenda.
I'd like to make a motion that we approve consent agenda A through B2.
Second.
Okay, we have a motion from Commissioner Whitley, seconded by Commissioner Miller. All in favor indicate by aye and raise your hand. That passes unanimous. Thank you. Unanimously. Okay, we're going to move on to item 9A. Receive information on North Trade Street, Matthew Station Street intersection project. This is from Susan Habina Woolard.
Hi, everyone. Thank you. I think we have a screen issue. Do I have control, Maureen?
I see it.
Okay.
Let me, 1 second, I'm having trouble. Let me see.
Okay, Jerry, is someone else running my slides? Because that's not me. You know what, let's just get started then, so as to not delay this.
Susan, it's not letting me give you screen access, or not letting me let you control the screen. I apologize.
Okay.
Susan, it's Jay. Just tell me when you want advanced slides and I'll move forward.
Okay. Will do. Thank you, everyone. Just a minute here while I reconfigure my own screen. There we go. All right. Thank you, Mayor and Board of Commissioners, for hearing this item tonight. It is about a 15-minute presentation with the intent of starting from the beginning and kind of giving an overview. Some of you weren't commissioners when we got this project started. We wanted to do a formal presentation again because we have a final design and we are close to constructing these improvements. Ideally, this would be in a separate meeting, face-to-face, where the public would come in and see the plans and ask questions. However, due to COVID-19 restrictions, this of course is not possible. Therefore, staff's idea is to present it to you tonight during your meeting, which the public can then also view. We appreciate the Downtown Mobility Study, Red Brick Partnership, and the Matthews Chamber for helping us get the word out about tonight's meeting. Since this is also for public information and will be recorded as such, please do hold your questions to the end of the presentation so that people viewing it for the first time can just have a thorough overview, and then we can jump around it and talk about different slides if you have questions. I'll be happy to go back on that. The only caveat being, if you can't hear me, definitely interrupt me and say, we can't hear you.
We can't see you.
Yeah, that's correct. I think what's most important here is the slides.
Right.
So sorry about that. I was sitting in a meeting earlier this week where I got kicked off 4 times, and so I didn't want that to happen tonight. So I thought it was more important that you see the slides than my video feed. So I apologize for that. And again, ideally this would have been in person, but we're not able to do that. In this presentation tonight, we intend to inform the board and the public of the purpose of this project, the timeline to date, proposed solution being the elements of the final design, construction phasing when the project does move forward to construction, and options for decorative treatment in the intersection. In 2017, the board directed staff to look into the safety of pedestrians using the raised crosswalk at North Trade Street and Matthew Station Street, specifically looking at in-pavement lights. Problems or issues that were observed and should be included for consideration in any improvements are: pedestrians wait a long time for drivers to yield so they can cross the street. Pedestrians are not visible to drivers due to parked vehicles. Pedestrians are not visible to drivers due to 2 lanes of oncoming traffic in each direction. Drivers from the side street often use gaps from traffic yielding to pedestrians to make their turns. There's limited space for side-mounted warning devices such as signs. The existing pedestrian warning signs are faded and obscured by parked vehicles. The nearby signals at Matthew Street and John Street are visible while driving in this segment in each direction, causing the driver's eyes to be up and ahead to the signal, not down to the street in front of them and the edges and the pedestrians. Improvements should improve MUTCD compliance for liability protection and specifically address Americans with Disabilities Act requirements. As always, anything that happens in the downtown should maintain the downtown character.
Susan?
Yes.
This is Jeff. What does the acronym MUTCD stand for, please?
I apologize, I didn't type that one out. It's the Manual of Uniform Traffic Control Devices, and that is what we use for compliance for national liability, or national compliance for liability purposes.
Thank you.
This next slide is one that our designer prepared for a prior presentation that visually depicts these observations. There's a steep driveway grade on the left side of your screen. There's the arrow. And because of that, that also makes that adjacent public sidewalk have ADA compliance issues, ADA being the Americans with Disability Act. Additionally, one or more of the crosswalks and ramps do not meet ADA compliance. You can see ahead there's the prominent signal as you drive through the intersection. We have an unmarked crossing in this intersection, that being across Matthew Station Street. The pedestrians, when attempting to cross the street, are set back from the travel lane and obscured by parked vehicles. We have a lot of lighting out there, but it's not sufficient to actually illuminate the pedestrians as they attempt to cross at night. We have a very long crossing distance as you try and cross North Trade Street. Staff spent 2 years providing information to the board and stakeholders discussing the issues and potential solutions and designs. I have 2 slides of this timeline here for you, and that's intentional. This is our 8th time presenting to the board on this project since the fall of 2017. I want to take a moment for a sidebar here and speak directly to the board members about something. Remember when staff said each project in the downtown mobility study would go through a thorough vetting? Well, this is exactly what we mean when we say that. This project is included in the downtown mobility study, even though it was started before the study started, and that this project set the precedent of how we might handle a downtown project. This project is a new design, and because of its impact to traffic and visibility of the project as well, we wanted to be sure the board was updated every step of the way. This may have drawn out the project timeline, but staff feels that's better for this project and ones like it in downtown. As you can see in this slide, we had an entire year of research and presentations before we requested preliminary design. The bold item on this slide is where we are today. Next steps after today, we'd like to continue to answer questions from the board and the public until May 6th, so that on May 11th, we can have another board agenda item to share the comments and questions received and, if appropriate, ask to seek bids. If that happens, then we might be able to start construction in the summer of this year. We don't have a full construction schedule because we haven't bid it, but we're anticipating it might take 4 to 5 months to complete.
Susan?
Yes, Mr. Miller.
Are you suggesting that during these 4 or 5 months, Trade Street would be closed for what percentage of that amount of time?
I'd be happy to answer questions about that after the presentation because I do talk about that a little bit in later slides.
All right, sorry.
Moving on to the proposed solution to the question of pedestrian safety in the issue of North Trade Street and Matthew Station Street. How do we decide how to make a pedestrian crossing safer? Typically, staff turns to national guidance on the topic. Here's some research from the Federal Highway Administration Guide on Pedestrian Safety Measures that was published in December of 2017. It talks about recommended components to be considered for pedestrian safety. Vehicle speed control. We've done a pretty good job with that as the crosswalks are already raised. Narrowing lane widths is another way to help with vehicle speeds if needed. I just want to remind you North Trade Street is posted at 25 miles per hour. Conspicuity to make crossings and signs more visible using crosswalk markings and perhaps flagged overhead or in-street signage. Shorten the crossing distance, increase visibility of pedestrians, and having pedestrians cross one direction of traffic at a time. All those things can be accomplished with curb extensions and pedestrian refuges. Improving the signing at the crossing to make drivers aware of the presence of pedestrians. And lastly, overhead lighting that illuminates pedestrians. Those pedestrian safety elements results in the final design. Next slide, please. With the following elements of the proposed solution. One more click. Conspicuity and signage is accomplished. Staff has a plan for consolidating existing signs, which allows for pedestrian warning signs to be added on all legs of the intersection. And crosswalks will be done in high visibility white ladder style on all 3 legs of the intersection. Curb extensions are shown here on the left and the right-hand side of the screen. Vehicular speed control, the raised intersection, the entire intersection will be raised, which provides the vertical deflection for speed control. Overhead lighting, about that, there's a current project. I don't know if you remember, it was released last fall to swap the overhead lighting. It was determined that that could be done as an interim solution because the new positions of the lights wouldn't preclude if moving forward with the construction project. Delays by Duke Energy, but I'm told they will be out this week to pour the bases, and the light poles will follow the week or 2 after. So you see how that street light is there in that position where the acorn light used to be. Also, ADA issues, Americans with Disability Act issues, are resolved with the reduced driveway grade and new ramp, which both also bring the adjacent public sidewalk into ADA compliance. The design engineer's opinion of probable cost for these improvements is approximately $385,000, and I apologize I didn't get that figure on any of the slides, but that is their opinion of the cost. So the question might still remain in your mind, will the intersection be safer? Well, I want you to keep in mind that statistically speaking, this intersection does not have a crash history that indicates pedestrians aren't safe crossing the street. But that doesn't mean they don't feel safe when they cross the street. So how do we measure that? An updated guide from Federal Highway Administration, from the one that I used in the prior slide, has been published with this really great chart on how certain countermeasures address public safety issues. The safety issues that staff observe at our intersection is actually tabulated across the top. The countermeasures, the things that you could do to address those that are recommended by the Federal Highway Administration, are in the first column along the left. These are recommendations because they've been rigorously studied and have proven safety benefits. Our proposed improvements, combined, address all of the safety issues. As you can see, I have highlighted on this slide: high visibility crosswalks, improved lighting, curb extensions, and raised crosswalk. If we feel we want to get more check marks in those last 2 columns, drivers not yielding to pedestrians and crosswalks, and insufficient separation from traffic, we could, in the future, implement more countermeasures. Advanced yield here to pedestrian signs, pedestrian refuges, hybrid beacons. However, we might wait until other NCDOT projects are done before we decide to monkey with our lane widths, or also rectangular rapid flashing beacons. That last one, the flashing beacon, was discussed in past board meetings, but the designer for the project didn't recommend it at this time. The firm believes that the pavement and curb solutions that they're proposing will show a greater improvement in the comfort level of pedestrians. Well, that wraps up the slides on the elements of the final design that address pedestrian safety. Now on to what next? What might happen during construction? There are 2 options that the design firm is considering on how to handle vehicular traffic during construction. The first is to work on half the street at a time. For example, the parking lane and 2 through lanes on the west side of the street in front of Brakeman's and Seaboard would be closed, and all traffic would be reduced to 1 lane in each direction using the lanes next to Matthews Station Street. Once the half of the street is done, then the traffic would be moved to the other side. Kind of like how South Trade Street is being constructed, where during each phase of the construction, the traffic shifts laterally across the road. The other option is to close the intersection entirely, blocking all lanes of traffic at this location, like what was done with the Idlewild roundabout. That might not seem ideal to do, however, But keep in mind, this part of town is quite well connected. I'll show you what I mean on the next slide. Both of these options can be included with the contractor providing a cost for both, as well as an expected construction duration for each option. Then the town can retain the right to select which method of construction based on criteria that we set, such as construction duration, impact to businesses, and cost. Here's an example of a potential around-the-block detour of the work area. Traffic coming from the north, past North End, would turn right onto West Matthews Street, then left onto Ames Street. From there, if their destination is John Street, they can go straight, or they can turn left onto West Charles Street if their destination is one of the businesses on North Trade Street. It's only an additional 1,000 feet, a distance that typically does not deter drivers, especially since this one is an easy around the block. If their destination is Matthews Station, then that's an easy left onto East Matthews Street to Matthews Station Street. Now for vehicles coming from John Street, the detour could be a right turn onto Old Depot Lane to Matthews Station Street, then left onto East Matthews Street. This detour is also 1,000 feet. You'll notice I'm showing 2 detours here, one for each direction of travel. To me, this would further disperse the detour traffic so as not to overload some of those smaller streets. However, it could be that the detour in both directions follows the same route, whether North Ames Street or Old Depot Lane. I do want to point out that the businesses that front North Trade Street on the north side of construction all have rear access from Matthews Street via Jill Lane or Bank Street. That's a really important note that you can still get to those businesses even though the work area is there. It's important that we stay in touch with businesses before and during construction to check on how the construction is affecting them. Next slide, please. How we phase construction not only affects traffic, but also businesses. We heard this as a public comment earlier. Here's an example of how we can partner with businesses during construction. These signs indicate that businesses are open during construction and provide a directional arrow how to get there via car. I've already talked to 2 business owners and also a property manager from Matthews Station about getting in touch before and during construction for help with these rear open directional signs. They responded favorably to that idea. Moving on to the final item in this presentation, the potential for some sort of decorative treatment in the intersection. After the ladder crosswalks are installed, the resulting box in the intersection is approximately 50 feet by 50 feet or 2,500 square feet. The red brick shown in this rendering is a classic look, perfect for downtown Matthews. However, there are options should the board decide to move forward with some creativity. The next slide shows us examples of murals from Oregon, Ohio, and Florida. There are some colorful options. One of the options in the lower left there is a county seal. This is probably on a crosswalk, but I wanted to show you an example of what a municipal seal might look like in this context. And then the one in the lower right-hand corner is an understated one. It's actually a compass that in the intersection that points to the north and has a decorative border. Staff cautions against too much going on in the middle of the intersection. Again, the point is to highlight the specialness of this intersection without causing more distraction to drivers who are already being bombarded with a lot of inputs as they drive through this corridor. Another option is the one that was shown in the rendering. It's a street print. There's a local supplier and contractors that install a proprietary product called street print that would provide a uniform pattern throughout the entire intersection rather than a custom mural. The 2 examples on the right are from a supplier. They show an arch pattern and a slate pattern. I found the photo on the left off the website of a local contractor. This shows how colors can be used in a contrasting pattern if that's what's desired. Some examples and colors for the street print product from the supplier's brochure. We're familiar with that brick pattern in the upper left. That's what's currently installed. There are other brick style, rock style, even arching patterns that can be done with street print. Borders to the treatment, if you want, could be done adjacent to the crosswalk lines, and the supplier's brochure also indicates a wide variety of colors that can be used. In summary, we shared in this presentation the purpose of the project, the timeline to date, proposed solution and how we arrived at that, construction phasing when project moves forward, and options for decorative treatment in the intersection. The slides and video will be posted to the website. The slides, I believe, are already up there because we have a fantastic clerk who gets stuff up there right away. The video will be posted to the streaming media page, and that is listed there, but you can get to it from our website. And questions should be directed to me. Here's my phone number and my email address. I have already received 3 comments. We appreciate Adam's comment from earlier, and questions received by May 6th will be included in an update to the board for the May 11th meeting that I discussed earlier. Now I'd like to receive questions from the board. If you could leave it on this slide, Jay, until there's a question on another particular slide so that people can have time to write down my contact information for questions. I do want to address, if that's okay, first Adam's question about the closure for the railroad. I had just started when that happened, and if my memory serves me correctly, we were all taken by surprise. And I would say that they did not have an appropriate detour set up. That doesn't mean that if we sign everything and we put up all these business signs that businesses won't feel hurt. Businesses always feel hurt during construction when vehicular traffic is reduced. That's definitely something that the board's going to need to consider. This project timeline, we'd always intended to construct this project in the summer when school is out. Timing perhaps is poor, and I am not an expert on how the public will respond to any sort of reopening. When that reopening would happen, who would reopen? I don't know if people will flock to town or if they're going to continue to stay away. Maybe Chief Mecklenburg has some idea, because the timing could align with when we had previously planned to start construction on this project.
I have a question.
Commissioner Miller.
Thank you. Susan, the number one priority that brought this was pedestrian safety, particularly at night, but in general. That being the case, my question is, could the bump outs be achieved and the 1 lane in each direction be achieved without closing down the street?
Thank you for that question. So the lighting is currently under construction, and they are doing that without closing the street. They might have blocked a parking space to get those in. The bump outs are not able to be achieved completely shutting down the street. We need to close the next adjacent lane for worker safety. So that would still result in a reduction of 1 lane of traffic. So instead of having 4 through lanes, you would have 2 through lanes, 1 lane in each direction.
I believe that the realignment from the most recent study that we had suggested that there's too many jogging of lanes between the drivers, not realizing that this lane is an add-on, but it's going to later be deleted because it's a right turn only in front of Christopher's and things like that. So I thought that the bump out was going to create 1 lane in the through direction, etc., and the parking was going to be realigned. I'm assuming that that is a matter of striping differently and creating the bump outs. Am I wrong on that?
Thinking about maybe 2 different projects. So the board was not ready to move forward with lane reduction at this time. So all the bump outs do is currently in the intersection. Can you go back to the a few more slides, Jay, where it shows the existing conditions? The bump outs really only take up the space that currently has pavement markings. All the animations is going to make it take forever. My apologies. Here we go. So in the lower right-hand corner of your screen, you see a pavement marking that indicates don't park here. The bump out is only going to go to that location. So it'll still, at the end of the project, have 4 lanes and 2 parking lanes, the bump outs will just shadow those parking spaces. Does that make sense?
It does. Thank you.
Susan, I have a question. Although we've become quite used to construction delays here in Matthews, I think the bridge at South Trade Street's been under construction since the late 70s, I believe. Can you tell me why this would take 4 to 5 months to build? I mean, it seems like a fairly simple paving job. Why does it take 5 months to do a relatively small area?
Excellent question. Again, that's kind of CJ and me thinking, what's the worst case scenario that would happen out here? Sure, it might take fewer months, but construction delays are predominantly because of utilities. We do have a little bit of underground work here, so we've got to install some storm sewer to catch some of the runoff from the elevated intersection. And we just want to be very conservative about expectations. I'm not saying it's going to take a year. I think June through, October. There's also different perceptions on what that means. So once people start seeing cones up, that's the start of construction. And then you'll see some kind of, like at the end, there'll be cleanup and regrading and seeding. That's still construction, right? So this is all encompassing. This isn't just people digging up the road. This is everything from the time you see like silt fence go up to the time that comes down and everything's restored. So I just wanted to be very cautious. June through August is also, we got hurricane season coming in. Our weather has been shockingly unpredictable, I would say. So I do want to allow for any disaster like that might happen.
Okay, thank you. Are there other questions? And I can't see everybody because we got the presentation up, so just speak up if you would like to ask Susan a question.
So, John, I got one for Susan.
Sure, go ahead.
Susan, I like the option of maybe just closing half of the intersection rather than detouring the whole thing. I just think that's a viable pattern if we could do that. Close half and then still have one traffic going one way, one going the other. And then when that one's completed, do the other one. And also, I like the diagram of the decorative with the red brick. That's a pretty, all those other designs, that one there, I like that. I think that looks real neat and feasible. I don't want to look too gaudy with a lot of design, but that looks really good with the red brick. Yeah.
Thank you for that comment.
Any other questions or comments for Susan?
Susan, get pencil and paper handy?
Yes.
I got a couple questions. One is in your image here. First question, there's no overhang lighting shown on the left-hand side of the image. Is that just a rendering faux pas, or is all the lighting going to come from the right-hand side?
It's a great question. So the way that the overhead light is designed is to be able to cast across this intersection. Now there's a limit to how far that light goes, but with the curb extensions, this one light on this side, and then there'll be another one on the far side of the intersection to light that approach. That is what the designers are telling me will illuminate the intersection.
Okay, I'm going to kind of hold reservation on that from a lighting standpoint, but that was item number one. Item number two is, are there construction drawings and or permits already in place? Because you're talking about starting sometime in the summer, which means you'd have to start executing on documents pretty quickly.
That is a correct statement. Yes, we do have final design, and our firm is working on the bid documents currently, as well as the 2 detour plans, the 2 construction phasing plans, so that we can get those couple different bid estimates. And we just wanted to take it to you now, and to the public now, so that we can get comments such as what we've been receiving about concerns about closures, so that the board can make a decision about whether or not they actually want to move forward this summer. Because you're right, if we want to build it this summer, we got to move fast on it.
Okay, and continuing with the line of questioning, what is the material that we're talking about? Is this a stamped pattern or a thermofoil? What is the finish of this product?
So what we currently have in the crosswalks is a street print, and it would be the same thing. It's a thick imprint that would go down in the fresh asphalts.
So we stamp, for lack of a better word, or is it really a film?
It is, so like when you put down the thermoplastic markings, then that is a thicker, it's not paint.
Thermoplastic.
Yes. So when you say film, I'm not exactly sure what you mean by film, but it's like the thermoplastic arrow markings that you see that it heats up and you stick it on it.
Well, but the thermoplastic is in my mind a film as opposed to something that's stamped and more indelible in the material. So that answers that question.
Well, there is a roller that goes to make the brick pattern. There is an imprint that makes the brick pattern in that thermo.
Correct. Okay. And to kind of go along with that, I don't have a problem with a logo in the center, although it be a tasteful logo. I'm not so sure something distracting would make sense, but something simple as the town logo or a compass rose or something that kind of breaks up the variety in the center. Maybe the pattern changes or the color changes would be fine by me. So let me, two more items. Is there any ability to go ahead on the pizza peel side? We've talked about this before, but we haven't really sort of dotted the I's and crossed the T's on this, is creating an Uber or Lyft space. The fact is that space would not be occupied by a car all the time, would also add to the greater visibility of the pedestrians. Was that any consideration?
It absolutely was, and that came up in the downtown mobility study. And that is something that staff can move forward pursuing at the direction of the board. It doesn't necessarily need to be tied to this project because the parking space configuration will remain the same. We did bring that up to in a meeting, Red Brick Partners, that was received. They're the ones that brought it up to us. It was everyone at the table received it favorably, as well as during the downtown mobility study stakeholder meetings, that concept was received favorably. So if the board wants to direct staff to move forward with pursuing that, that can be a separate project.
I mean, I think something if you're going to spend this kind of money, it needs to be integrated now, as opposed to waiting after the fact and we do it piecemeal. That doesn't make sense at this stage in the game. Now, one of my other questions would be, it may not be a standard transportation piece or something like that, but what about the nature of a warning device or a rumble strip or something in the pattern of the asphalt before a person hits the speed table? Because one of the things, this is sort of on Saturday mornings at the coffee shop, it's great entertainment to watch people fly over this thing. And I consider they're going to continue to do it again. Is there a means or a method in which you rough up or rumble the asphalt before you get to the speed table that gives the car a shake that gets that person on notice that something's going on? I'm not sure quite what it is. Spikes would be great, but anyway, so there's a thought about that. You don't have to answer at this stage in the game, but my high-level concern about this is the idea of closing down the street entirely. I think the mayor has gotten the same emails as I've gotten. I think you could strategically partition the street off and have traffic move through. And the reason, not so much that you created the detours, is the reality is the detours you created are taking, for the most part, a lot of non-residents through parking lots. I mean, let's face it. Depot Lane and the street in front of Town Hall is a parking lot. And you're asking about detouring normal traffic where people are very impatient racing past Town Hall. So I think the safer bet is to just swap one side to the other on Trade Street and deal with from that aspect of it. And then we don't have to worry about people navigating down Depot Lane or in front of Town Hall at excessive speeds, and likewise down the other side, back down, not Charles Street, but Ames Street. So that's my druthers on the terms of just having half the street operated on. I would think at some point in time, the road would have to be completely closed down because they would want to do the thermoplastic treatment all at one time. But I would see that would just be a series of a couple days of shutdown, not weeks or months.
Thank you for your comments. I do want to provide additional information to the board on your comment about rumble strips or roughing up the asphalt in advance of the raised intersection. This was not taken into consideration during the project because studies have shown that the noise that results from the rumbled asphalt has negative impacts to adjacent properties. But if that's something the board wants us to look into, now the brick indentations would have a little bit of kind of that rumbling effect, but not until they're actually in the intersection, right? You're talking about ahead of the intersection. Could a rumble strip happen?
Ahead of the intersection. I think, frankly, if I heard that noise and I was in the intersection, I probably would look. I don't want to be hit by a stealth car, that's for sure. But just something, again, is another layer of some way to slow traffic down and also make that intersection a little safer. I know we haven't talked about it before, but in looking at this rendering and crossing this intersection many times, it was just sort of something that resonated in my mind about, what if there was something there to sort of signal the driver there's something going on. And also the noise would indicate to the pedestrian to maybe look in the direction of the noise.
I have a question.
Sure.
What's the timeline difference between shutting down the entire road or doing half at a time? Is there a significant timeline difference between the two options?
That's a great question, Commissioner, and I don't have the answer at this time. Each contractor operates a little bit differently. And so some contractors might say, oh no, it's way better if I work on it a half at a time. And some contractors might say, oh, it's way quicker if we shut down the entire intersection. As to that duration difference, we're not sure. And that's why I recommend moving forward, obtaining bids that also require the contractor to provide a timeline. Then I'll have that information to share with you and you can make a better decision at that point. I don't want to play any guessing games right now. Contractors are seeing some reduction in staff, not a lot, but construction is considered essential and is moving forward. So construction companies are still working.
Thank you.
Susan, I have a comment based on our conversation earlier tonight, and God willing, many of our businesses in the downtown area will just be acclimating to the new normal when we're suggesting shutting down half or all of the street. And my recommendation or thought would be, would it be possible to consider moving this out, perhaps to the following spring or something? I'm just concerned about shutting this whole area down just at the time when businesses are starting to reopen.
Excellent point. I will say that my job is to move projects forward and provide you the best information that I have. And so I'm following our current timeline. If the board chooses to delay this to next summer, then that is definitely something that you can consider. You can direct staff to do. I think it's good to hear the businesses and hear that their opinions about it. I don't know if anyone else has better thoughts on how the traffic might start increasing. Will it start slowly? Will it suddenly be back to 9,000 vehicles? I don't have those answers. So it could be that things ramp up very slowly and in June and July, we're still seeing very low numbers and it's very little impact. It could be that everyone floods downtown and even one lane in each direction would be impactful.
Do any of the other commissioners have a thought on delaying this? Think it's a good idea, a bad idea?
What's the best time to do road construction as far as weather is concerned?
Summer is the best time to do construction, not just for weather, but also when you're in close proximity to a school.
Commissioner Bland. You're muted, sir. Thank you.
I'd just like to say that, it seems to me that the traffic is much, much, much less right now, okay? And I suspect it's going to be similar during the first few months of the summer. But if that's the case, still, if we could do half of it, so that, one half the street gets done, the street's still open so that the reduced amount of traffic can get through much easily. If we wait until traffic back to full gang busters like it normally is, doing half of the street is going to be unacceptable at the same time. Do you see what I'm saying? So that's sort of my thought. I don't know what the other commissioners feel about it, but we need to keep the road open so the traffic can go in there at all times. And I just don't see. The road. I think that public safety requires that we get this done. It's going to be almost impossible, I think, to do it just at night times. I think that would be too difficult to do. But by keeping at least half the road open and doing it at a time when there is less traffic because of this pandemic may be the best solution. But that's just my thoughts. I'd like to hear what other people think.
I agree with Commissioner Bland.
Town Manager Blodgett.
Mr. Mayor, members of the board, I think one of the interesting dynamics here is the impetus for this whole project was safety, pedestrian safety. We're worried about this very busy intersection, and in the winter, all this darkness and stuff. And I think the consensus was to move forward as quickly as possible. But now we have this overlay of the pandemic that's, is this thing going to threaten businesses if we went ahead on our normal time frame? But my advice would be to bid it out, and then the board has to really work its way through. Can we keep this road open? Will it have a minimal impact, on the existing businesses coming out of the pandemic? But one of the guiding factors was, let's make this intersection as safe as possible, as quickly as possible.
I based my comment on the fact that Susan said that there wasn't a great number of accidents in this area. Perhaps it's more providing a feeling of safety for our people than or perception of safety than actually being a concern. But I'm not hearing a consensus to delay. Is that correct? Okay, so any other questions for Susan?
No, sir.
Thank you, Susan. Very good presentation as usual. We appreciate it. A lot of good information. Thank you.
Thank you, everyone, for the good questions.
Let's move on to item 9B, consider additional funding for full-depth reclamation road project. Mr. O'Neill.
Thank you, Mayor, Commissioners, and I'm sorry if I glance up my monitor seeing you guys are all above on a second screen. My memo is below, so I'm not intentionally not making eye contact with you. So I'm here basically asking for additional money for the resurfacing contract. The resurfacing contract, we ran into some ADA issues that really overdrew that item. There were a lot more things that had to be done that we found when we had a consultant come and look at Town Hall and all the issues that were there with sidewalks. We realized that additional things had to be done with this project to make sure that it met ADA. That was roughly $125,000 additional to the contract. In the original amount that we requested, we did not include $100,000 that will be repaid from the Streamside Subdivision Special Assessment. And what we're asking for is for that money to be added to this project, and that will be reimbursed by the residents over the period of the special assessment. That leaves a gap, though, of $25,000 that we think we can accomplish with our internal budget. So basically, what I'm asking for is to push that money, $100,000, to this project and have it be reimbursed over time.
Any questions for CJ? I'll entertain a motion.
I'll make a motion. We approve the affected budget ordinance.
Second.
We have a motion from Commissioner Miller, a second from Commissioner McCool. All in favor, raise your hand and say aye.
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 Don't think there's any opposed, so that passes unanimously. Thank you. Move on to item 9C, consider Town Hall Road resurfacing project.
Thank you. Great to be back. So as you're aware, the RNC is coming to this area, and this allows us the opportunity to use tourism funds for some things that we otherwise wouldn't be able to, including renovations and things around Town Hall. One of the projects that we brought to the board was resurfacing Town Hall. Jay, if you can move to the picture on the third page, I think. Give you a nice picture to look at. And that gives you an idea of what will be done with the resurfacing, with the crosswalks. Again, with the consultant coming, we identified additional things that had to be done to meet ADA and ADAG. That increased what our estimate was. The one I brought to you originally was $435,000. After these additional items were added, that brought my estimate to $562,000. We did go to bid on April 6th. We received 3 bids. The low bid was $533,168.16 by Boggs Contracting Incorporated. We did determine them to be the lowest responsible bidder. We have used them in the past and have been satisfied with the work that they perform. This project also includes some work in private areas that's shown in the purple. It's outlined in purple. We have talked to Latperson Associates about this prior to the bid, and they have agreed to pay for their portion of the project that's privately owned. That's roughly $38,000. What we're asking for now is the contract amount plus approximately a 10% contingency. That brings the project to $590,000. This contingency will allow for any additional items that come up, as well as a few items that were found in the Crestel Heritage Trail that would benefit that project that we thought we could go ahead and do as part of this project because they were not part of the original project, the Crestel Heritage Trail. We will likely be pursuing financing for this, but that will be brought to the board in a future date once that has been arranged. Right now, we're just asking for the board to allow us to pursue the contract with Boggs Construction and to authorize the attached budget ordinance for $590,000.
Okay, this will require then 2 motions. I'll entertain a motion to allow staff to execute the contract, if there's no questions.
I'll make that motion.
Commissioner Bland? You're muted, sir.
I would just say, can we talk about this for just a second? Is that
Absolutely.
Okay? I'd like to get a couple questions answered so I know what I was voting on. But, we talked about a lot of these big projects that are spending a lot of money, in this budget that we got coming up. And maybe it not going to be affected by what's going on. But what I'm concerned is tax revenues and the RNC funds, are the RNC, are they really coming? Number one, and two, are those funds for sure? And are our tax revenues going to be affected such that we need to think about, which are the key projects that we really got to have, and there's some of the projects that are wish items that things were booming a month ago, 2 months ago, when we were having our retreat to discuss the budget. There's a lot more money that people were thinking was going to be available. Is that money going to be available now to do all these projects? I'd like to hear from the town manager.
Town manager, Blodgett.
Yeah, this is a really great question, and we are in uncharted territory in many ways. What you'll see in next year's budget, which will come to you guys in a couple weeks, is it's going to be a very tight, lean budget. Revenues are flat. And, just think about all the things that we've watched come out of the ground, even with all that stuff out of the ground, revenues are flat. We're going to bring you guys a conservative budget. Right now, I don't plan on proposing a tax increase. So the question is, okay, well, that's good to know. We do have a healthy fund balance, right? We've always been good about that. What CJ's proposing is to take this money out of the general fund, which is, the money that we get from property tax revenues, that's the savings account, temporarily. And then what we're going to come back to you guys with is with the financing plan, because we have to go through the local government commission to do this, and use tourism funds. Now, tourism funds are good because that's hotel, motel, and prepared food tax. Those are going to be significantly down at the end of this year and the beginning of next year. They do think they're going to rebound. We do have a very healthy fund balance, and what we propose to do is finance this money, this $650,000, over close to 5 years. That's the plan. And so we pay ourselves back over time. Here's the key in my mind, though, is that the attorney, thankfully, has said, in his opinion, it's okay to use tourism dollars for this big project, because if you drive that area, it's 20 years old. We're going to have to do something. And to me, we've got a great opportunity with the RNC coming to legally use tourism dollars, because guess what? If we don't do anything and the RNC doesn't come, we're still going to have to come back to y'all in a year, I don't know, probably 6 months or a year or something, saying we still got to do this project. So from a staff perspective, these are difficult times, but we think the timing is right, and the attorney's given us approval to do this. So I feel strongly we should push forward and get this off our plate.
Okay, well, thanks. Appreciate it.
Any other questions? Okay, I'll entertain a motion to allow staff to execute the contract.
I'll make that motion.
Motion by Commissioner McCool. Do we have a second?
I'll second it.
Whitley.
It was Commissioner Whitley, so seconded by Commissioner Whitley. All in favor indicate by saying aye and raising your hand.
Aye.
Okay, all opposed? That passes unanimously. Thank you. Okay, we're going to move on to item 9D, consider rent deferral or abatement request for Matthews Chamber of Commerce. Town Manager.
Mayor, did you say there was there a two-part to that?
Oh, you're right. That's correct. Thank you, sir. So we need a second motion to approve the budget ordinance amendment. Do I have a motion to do that? Motion by Commissioner Miller.
I'll second it.
Seconded by Commissioner Whitley. Again, all in favor, say aye and raise your hand. Aye.
Aye.
Any opposed? That again passes unanimously. Thank you, Commissioner Whitley, for keeping me on track there. Moving on to item 9D, consider rent deferral or abatement request for Matthews Chamber of Commerce. Mr. Blodgett.
All right, Mr. Mayor, members of the board, as you can see on the screen, there is a request from the chamber as a result of the COVID. They're asking, in their request, they're asking for a deferral of 3 months. It's whatever, 3 months times $750. We can absorb that loss. They are proposing to pay us back, I guess, next fiscal year, but I think Mayor or somebody has mentioned, well, could we just forgive it? So their ask is actually a deferral, but the agenda item says deferral or abatement. So I think it's the board's decision on whether or not you would just want to forgive these three months.
Mr. Mayor, I'm on that board with the chamber, and I would like, it's $2,250, I think it is, for 3 months. I would like us just debate that and being able to help the chamber out.
Is that a motion, Commissioner Whitley?
Yeah, that's a motion.
Okay, we have a motion to abate the rent for 3 months for the chamber. Do I have a second?
I'll second that.
Seconded by Mayor Pro Tem Garner. Again, all in favor signify by saying aye and raising your hand.
Aye.
Aye.
None opposed, so that passes unanimously. Thank you. Go on to item 10, new business. 10A, receive the monthly budget report. Ms. Blair.
Yes, hi. Bear with me. I lost my computer, died, and I'm on my phone, so let me give this a shot. Can everybody hear me?
Yes.
Okay, great. So I'm reporting on the first 9 months of the year, and through that point in time, we were tracking along well. We had over 20 million in revenues, which is almost 74% of our annual budget, which is consistent with percentage-wise where we were the prior year through the first 9 months. My projection, like Hazen just said, we're expected to be down in for the full year in sales tax revenue and also our investment revenue because of the reduction in the interest rate. But overall, because we are projected to be up quite a bit in property tax, which we've collected over 100% of our annual budget already, and vehicle tax is up. The ad valorem taxes will more than offset the reduction for the rest of the year in the sales tax and the reduction in our investment earnings. So I'm projecting we'll end this year being up in revenue versus budget, but
I missed that.
Wow, we lost the important part.
That was a key, man.
Did we lose Beth? Hazen or Becky, can you fill in?
Becky, I can't. I don't know what she was going to say. Jay, can you scroll up and down the screen so we can kind of see the numbers, see if we can figure it out?
1.4?
I'm not exactly sure what she was going to say either.
All right, scroll on down, Jay. Let's just see. See expend. Okay, stop.
Is it the blue number?
That's tourism fund, Hazen.
Yes.
Okay, so you scroll back up. Is Jay driving? Who's driving?
What's the blue number right there?
I think Jay's driving.
Encumbrances.
So that's 9 months. I tell you what, we'll just have to maybe Beth will get back on. We could always go to another item, but we will definitely give you guys we will finish this item out. The question is, how are we going to end the year?
It sounded very positive, but we want to hear the numbers. So we'll see if we can reach back out to Beth. Let's move on to 10B. Consider a state of emergency ordinance. Chief Kinnenberg is going to present this.
Council, as we've gone through the litany of COVID ordinance declarations, we did find out that in 2012 we were operating under state statute 288, and in that statute was replaced with the Emergency Management Act, which we call 166A, and it repealed 288. In 288, the mayor was given the authority to proclaim an emergency. In 166A, the council needs to authorize the mayor to proclaim an emergency and enact such measures as are deemed necessary. So all we're doing is instituting an ordinance that follows state law and clarifies the power of the mayor when authorized by the council to proclaim an emergency and set certain standards.
Questions?
Mayor, I'm happy to see this. I was sort of glancing over all the rest of them. Everybody had one with Matthews, but Rob, I'm glad to see we got that in place now.
Yeah, Commissioner, this is how we've been de facto operating, and this reflects the language in the town's emergency management plan and the state law. So this just puts us in compliance with our own ordinance.
That's real good. Thank you, Chief.
I have a few questions, please.
I thought you might. Commissioner Miller, go ahead.
Thank you. This state of emergency 102-1, it doesn't apply to COVID-19, however. Is that correct?
Yes, it would, Commissioner. It
would apply to any emergency, correct?
It would apply moving forward.
What I'm concerned about is that it gives the mayor 100% of the power. For example, a half hour ago, we were voting on the how we were going to handle a soft opening, or however you want to term it, the stay-at-home comparison. But I question that this gives 100% of the authority to the mayor instead of the board. And second to that, there are 12 times where it mentions city council. And so it's obviously a copy and paste, but it needs to be refined to where it says the town of Matthews, or town council, town commissioners, however you phrase it. But I just don't want to give the mayor full power to make these decisions. Go ahead.
Mayor, I address Commissioner Miller's concern.
Mr. Buckley.
Thank you. The primary reason why the statute and the common practice of all the cities is to give the mayor the position is because when a natural emergency may be created by a storm or sudden emergency, you cannot convene the town board to make such a declaration. You need one person to be able to have that authority, because a state of emergency can occur like a hurricane or something, and you don't have time to convene a majority of the board to give proper 6-hour notice. You need someone, and if you remember, in order to get FEMA reimbursement of storm or other expenses as a result of the declaration, it only entitled to reimbursement from the moment the declaration is issued. You don't have time, most of the time, to wait for the board to hold a meeting to be able to adopt a declaration of emergency. You need to name the mayor.
I understand that, and if a train derails or a hurricane or tornado goes through, you do need a point man to make those calls. But we've been cleaning our closets and garages and throwing out yearbooks for 7 weeks now. And so that's why I asked about the COVID-19 application.
Well, we've already passed that point. The statute does provide that in dealing with the county, it says that when they issue a declaration, that either the town board or the mayor may request a different, or may concur or request different makeup of the proclamations and restrictions.
Charlie, I have a question. If I signed an order that the majority of this board disagreed with, could they overturn my decision?
They could, but they would have to have a normal regular session of the board or an emergency session to be able to do that.
So, from my perspective, and I've talked to this with some of you, I think it is for expediency so that somebody can sign an order quickly.
Sure.
I certainly have no power with this entire board deciding whenever it's feasible, but, I'm mayor now. Who might be mayor next time? I don't know. May have different opinions. I think it's for expediency, and I will try to go to this board and get your concurrence on anything like this.
But that's why the majority of the municipalities have it set up under the statute, and why the statute is written like that.
That's right. All the cities in Mecklenburg County give the mayor the authority to enter into a state of emergency.
All right, can we change the 12 references to city council to town council then?
Certainly.
And we didn't board, yeah, whatever.
Commissioner Miller, I'll point out that we found out Friday we didn't have an ordinance. So I'd quickly drafted this thing so we can make that correction, no question.
Who else will be signing it other than yourself, Charlie?
Well, the board would adopt it, but that's the way all your ordinances are, with the town attorney approving as the form.
So the mayor doesn't sign it?
Signed by the mayor. No, the mayor signs resolutions, the town attorney signs ordinances.
Thank you.
So,
do you approve it?
Do I have a motion to approve this ordinance with Commissioner Miller's suggested changes?
So moved.
Second.
Motion by Commissioner McCool. Do we have a second?
Second.
Second by Commissioner Urban. All in favor, please indicate by saying aye and raising your hand.
Aye.
Aye.
Any opposed? Seeing none, that passes unanimously. Thank you. Let's move on to the next item. Consider request for town social media support. This will be done by the town manager.
Yes, sir, Mr. Mayor. Just as a FYI, the finance director, Beth Blair, is back on the. Okay, good.
I'm sorry. Let's go ahead and finish that item then. Beth, Beth, you started to give us some exciting news, and then
Yes,
went into the
I'm not
ether
sure
somewhere.
where I cut off, but let me backtrack, and I apologize. First my computer died, then my phone died, so I'm having issues. So, all right. So where we are, even though we are looking at reductions in sales tax and the investment earnings, because we did well so far for the first 9 months, we should be favorable revenues versus expenditures at the end of the year, certainly by at least a couple $100,000.
Okay.
Is my projection at this point in the general fund and the tourism fund, which the good news there, the food and beverage tax, you only receive it twice a year, and we had collected all of our revenue already this year for food and beverage before the pandemic started. So it's really the occupancy and rental car tax that's going to be down, but again, I think we'll be okay there. I'm projecting our revenues will be down in tourism by about 145, 150,000, but also our expenditures will be down, and there won't be as much transfer of the tourism fund to the general fund because our recreation activities that are funded partially by the tourism fund are basically shut down, and expenditures are going to be down. So I think we'll be okay in the tourism fund for the year as well. So good news for this year. I think we will fare okay. But as Hazen said, it's certainly a bigger struggle, and we'll talk about that when we talk about next year's budget. But for this year, I think we'll do okay.
Okay. Thank you. Are there any questions for Beth?
I have a question for Beth.
Commissioner Urban.
Beth,
Yes.
knowing that we have several major construction projects underway, do we have an idea of what percentage we're at collecting? I guess what I'm saying is that some are more than half completed, and we only get revenue based on their level of completion. So there's some silver lining in this, that 3 $25 million projects will be wrapping up probably budget time next year. Have we begun to receive some of that money for the partially completed projects?
Not yet, but yeah, that's.
So let me, I can jump in a little bit here. So it's an interesting question. So the way I understand it, Mecklenburg County will go out on January 1st or just before January 1st, and partially they have thresholds. And if buildings are X percent, 25%, 50%, 75% completed, they will assign a value to them. So in next year's budget, I think the number was $400,000 in new revenue. Becky, do you remember if that's correct? On the property tax side?
Yes, that's about right.
Okay, good.
Yeah, I was just over that.
So that's the good news. The bad news, as somebody said, in the current year budget, under investment earnings, we budgeted $350,000 plus or minus. Next year, we're budgeting $70,000. And it's not because we've taken a big hit on our investments. It's because the feds, right, just whatever, gash the rates. Yeah. So, and then sales tax is going to be flat, at least for a while. So that's where the balance, we got a little bit of good stuff from the stuff that came out of the ground, but we got knocked on both sales tax for next year and investment earnings, and then some of the state collectors.
At least we have it. I mean, that's the good news, is that we have that as an offsetting penalty.
It's really true. I mean, it reminds me back when we went through the recession, and down in Florida, Lord have mercy, it was a bloodbath down there because of the housing bubble. We didn't have the big uptick, so we didn't have the big downtick. We just kind of hunkered down, weathered it, and came out of it. I think next year is going to be a similar year. We're just going to have to hunker down. I'm sure y'all are as optimistic as I am that in this community or this metropolitan area, we'll bounce back as quick as anybody in the country.
Any other questions for Beth? Somebody said something. Are there any other questions for Beth? Okay. Thank you, Beth. We appreciate the good report. Thank you very much.
Sure.
Now we'll move on to item 10D, consider request for town social media support. Mr. Blodgett.
Yes, sir. Excuse me, Mr. Mayor, members of the board. So this is an interesting memo about, as one of the things that we're seeing with this COVID is a number of us have had a lot of people reach out to us that are in need of food and shelter. Shelter in the form of both rent and utility payments. That is not something the town's set up to do. I don't know if anybody else, but you say, okay, call 311 or 211. And I got a lot of people saying, I've done it 17 times and it's just busy and I can't get in. And we found out that the help center is really perfectly set from a mission standpoint to do both of those two things, but they're still working, but the store's not open. And so there is a group of folks in town that have come together and want to do a fundraising effort for the help center. And they want to do a GoFundMe page. We do have a policy that the board adopted in 2018 that allows you guys as a board to say, yes, this is a worthy, well, here's what they want. Let me just say what they're looking for is they're not looking for money. What they're looking for is the ability to tap into our social media platforms. And this, there's a policy attached to the memo that gives the board the authority to do that. Now, in the process, one of the processes is like you get this request and then you refer it to the committee, advisory committee that's most closely aligned with this. In our case, none of our committees are meeting. So my thought was, well, let's just bring it straight to the board. It does give, you guys do have the authority through this ordinance to allow, in this case, this fundraising group to use our social media to get the word out to try to raise funds for the help center. So I'm recommending that we go ahead and approve this.
So if I could add a little bit of flavor to this request, these are local leaders in our town that I'm sure most of you are familiar with. They've asked me to participate in this group. Also participating are former mayors Paul Bailey, former Mayor Jim Taylor. I talked to Lee Myers today. I believe he's going to be involved. Barry Steiger, Noby Thrasher, Barbara Dement, Steve Huff. It was started by MB from BAPS. Very ambitious. They got together. Dr. Vasant Patel is also in the group, and I'm sure I'm missing some folks. It's people that you all know and kind of respected leaders in the town. And they started out with, tried to identify the immediate needs of the help center. And the help center said, we really need about $10,000 just to satisfy our immediate needs right now. And so their initial goal was $10,000. And they have since upped that to $100,000. This money will go directly to the help center, and the help center can vet how those funds are handed out to our community. And so I'm recommending that we approve this, go ahead and allow it to be posted through our social media sites. And also I would encourage any of you that are still receiving a paycheck on a regular basis and can afford to donate, consider doing it for those that are less fortunate, because this money is dollar for dollar going right to needed families that need help right now. So wanted to give you a little more information about it, and that's what it is and what it's all about. So we appreciate you approving this request.
Mayor, can I make a motion?
Sure.
Could I ask a question before you make that motion, Jeff?
Yes, sir.
Mayor, this social media is strictly just for the help center in this time of crisis. Is that correct?
The name of this group, I believe, is the Matthews COVID-19 Forum, and they have a GoFundMe page already set up and a Facebook page, and they put some videos up. But yes, all of these funds, initially, and Commissioner Urban and I talked about this, initially there was talk of starting a new thing, a new charity or whatever, but we all realized very quickly that the Help Center is uniquely set up to address these issues. They can vet who gets the money, how much they get. They can make sure they tick off certain requirements. We can make sure that only people that really need the money are getting it. So to answer your question, I kind of rambled on there. Yes, this money would all, currently all the money raised would go to the Help Center. Now they do have some other outreaches they're considering in the future that might go to the free medical clinic, or maybe to help something that the chamber's doing to help businesses get on their feet. But for right now, I think this initial push for the $100,000 would all go to the Help Center. Does that answer your question?
Okay. Yeah, it did, but I just want to make sure that the social media is just for this project, along with maybe something else, but just for this being able to use our website and social media, and just for the Help Center raising and corporate. Is that correct?
Yes. Mayor Pro Tem Garner, did you have a comment?
Yeah, first I want to recognize Hazen, because he was really the one who came up with the idea of getting funds to the Help Center to help those most vulnerable. So it was really a good idea on Hazen's part to figure out how to match those needs with the finances. My second question is that when other entities come forward to our board that are raising money for the Help Center, are we going to give them the same courtesy that we're giving to this group?
I think that would be up to this board. Isn't that correct, Mr. Blodgett?
It is correct, but and I would like to defer to the attorney. Charlie, correct me if I'm wrong, but you're as a body, you guys don't have to. This is not precedent setting. You don't have to. Oh well, we need to do this for anybody else. As a legislative body, you don't have to worry about precedent. It's strictly what the values of you as a board and what you want to support, provided it meets the policy.
Well, that's true to a certain extent, Mr. Blodgett, but at the same time, the board has a history with the Help Center. When they first began their ministry, their mission, they rented the Clark House back in the late 70s. The town provided the Clark House to them with a nice rental, but they paid the rental, but the town provided infrastructure to the Help Center to help them get started and to get underway. So the town has a history with the Help Center, unlike any other nonprofit in this type of situation. So I think the town would have a legitimate nexus to be able to provide the service to this, to the Help Center, when it may not be feasible to provide it to another one.
That's what I was saying, that if other groups are raising money for the Help Center and come before the board and ask for social media outreach, are we going to, as a board, I'm asking, are we going to extend that same courtesy?
I will speak up. I would not recommend do that. I think it's a slippery slope. I think the pandemic is a totally unique situation that none of us have seen in our lifetime. And for me, it's a one-off because I can see our social media platforms quickly getting corrupted. It's too strong, way too strong of a word, but lose its message because, it's not advertising, we're just trying to get government information to people. So to me, this is a one-off, a special situation that I would hope we wouldn't do again, probably.
Yeah, Hazen, I agree with you wholeheartedly. And Renee, to your question, if we approve this board to go ahead and do that, if anybody else want to give to the Help Center, let them go through this board and give to, because we have, as commissioners, have long helped the Help Center at Christmas. I know a long time ago, we always would pitch in and give some extra for the Help Center at Christmas time. So if anybody else would want to help, give some money to that, let them go through this board that we approved tonight.
Commissioner Urban.
In light of the fact that Hazen said this was a one-off for COVID-19, and I'm seeing a lot of plans like PPP and loans from the SBA, et cetera, limiting it to December 31st of 2020, could we make this motion contingent to the fact that this timing of social media no later than December 31st of 2020. This, by giving a time frame, we sort of set limitations, and that might also help in precedent making down the road. Should the board decide to do it for other players, maybe time frames are also allocated there as well.
That would
motion,
be
Commissioner Urban? Would you like to make that in the form of a motion?
Charlie gives me the blessing. That's my motion.
I said that would be appropriate. That would be appropriate to put a time limit.
Okay. Well, then I'd like to go ahead and make a motion that we offer up and provide the social media through the town services to the help center for a duration not exceeding December 31st, 2020.
I'll second that, John.
Okay, we have a motion from Commissioner Urban, a second from Commissioner Whitley. All in favor indicate by saying aye and raising your hand.
Aye.
Any opposed?
Nay.
Okay, so
One opposed.
one opposed. So I'm gonna go ahead and call the entire roll again. Commissioner Bland, how do you vote, sir?
Yes.
Commissioner Urban?
Yes.
Mayor Pro Tem Garner?
No.
Okay. Commissioner McCool?
Yes.
Commissioner Whitley?
Yes.
Commissioner Miller?
Yes.
And I vote aye as well, so it passes 6-1 with Mayor Pro Tem Garner in opposition. Thank you. All right. This meeting is a little longer than I anticipated. We'll go on to the mayor's report. I want to thank this board. I've had a lot of interaction with you over the last couple of weeks. These, again, are extraordinary times that we've never seen before. It's very stressful. And I'm thankful that we can, I remember saying this to Mayor Pro Tem Garner in particular, but to all of you, I appreciate healthy debate, and we're not always going to agree on everything, but I'm glad that this board is able to debate and come to some sort of consensus or listen to everybody's opinions, and that means a lot. I think it's also really important not to overly politicize this pandemic. I mean, this has nothing to do with politics. It's a tragedy that we must overcome, and so I hope we won't fall into this category or that, but continue to do what's best for all the citizens of Matthews, and I think we're doing that, and I appreciate the healthy and respectful debate we've had tonight, and that we continue to have, and that we continue to work together to do what's best for the citizens of Matthews. Would anybody like to make a comment to that? Okay, we'll move on to the town manager's report. I'm sorry, the attorney's report.
No report, Mayor.
Now the town manager's report.
Only thing I'd say, Mr. Mayor, is I do watch every day. We get on the call and I watch these professionals at the county level working very hard, really in the best interest of over 1.1 million people. And then on our town staff, you guys, we talk every day, and we have great professionals that are kind of helping us guide through this. And of course, we'll make it through.
Thank you.
Okay, thank you. Entertain a motion to adjourn.
So moved.
Moved by Commissioner McCool.
Second.
Second by Commissioner Bland. All in favor indicate by saying aye and raising your hand.
Aye.
Aye. Good night. Thank you, people.
Thank you.
Good meeting. Y'all stay safe, everybody.
Yes.
Good night.
Good night.
Right.